running a little late, but before I fill in for the co-chair, just to be official, I want to kick it over to our chair, Mayor Carbone, just to kind of kick us off and call the meeting to order, and then we'll jump right in to tonight's business.
All right, there it is. So thank you, everybody, for coming out. For all of you that took time out of your day to come out and share some of your experiences with us, just as a reminder, the purpose of this commission is to develop talking points, strategies, and a better understanding of what it is that has created this crisis in the state of Connecticut. It's a national crisis, but the focus for us with the state of Connecticut is the 119,000 young people between the ages of 16 and 22 who are experiencing disconnection from their community, whether it's, a moderately at risk of disconnection, disconnected, or severely disconnected. This is our second public forum, although we did also do a roundtable discussion with some of the youth in the Waterbury area. And every time I sit down and listen to the stories that you have to share, I am reminded of how remarkable the state of Connecticut is, how remarkable all of you are in your commitment to solving this problem or helping us create some solutions to this problem. So with that said, thank you very much for being here. At this point, I think I'm going to kick it off to my co-chair, Andrew Ferguson from the Dalio Education Foundation.
If I may, I will first hand it to Joe DeLong, a commissioner with CCM. We're like playing soccer.
Mayor's keeping me straight over here. Thank you for that. So before we jump into the agenda, we do have an amazing host this evening, and I want to give her an opportunity, the mayor, to kind of welcome everybody to her town, her beautiful council chambers here, that it really is ideal for this type of work and this type of setting. And I will tell you, bringing a meeting, a very important meeting, to a very important part of the state that has a lot of people impacted, a lot of young people impacted here in this part of the state. We struggled to find the forum that was the perfect forum, and this really was the perfect forum, and a lot of thanks to Mayor Tony Moran for that. So, Mayor, would you like to just welcome folks to your town? Hit the... Yeah.
You all know that Mansfield has a very long commitment to education. You are sitting in the Storrs Grammar School auditorium. You may not have known it, that there are people in town who actually went to school here. But we took it over, as we sometimes do. At one point in your visit, I hope you have a chance to take a look at our new elementary school. We consolidated our schools. We have the first fully net neutral new elementary school in the state. And we just got the data, and for one 12-month period, we actually generated more energy than we used. So about a month or so ago, the Lieutenant Governor came to Mansfield with the Deputy Education Commissioner and the Commissioner of Children and Family Services, because they believed that Mansfield schools had some of the best programs for dealing with this issue. And so I can't speak for the Board of Education and its staff, but we're very proud of our education and the work we do to keep kids tied to their schools and to their communities. So I'd like to welcome you and say thanks for being here and thanks for doing this.
Thank you, Mayor. Thanks so much for having us. So already, you can see deviating from the agenda, it says, welcome from co-chair Josh Brown. Josh is on the way. He got hung up in some traffic. So I'm Joe DeLong. I'm the executive director and CEO of CCM. And so we're going to jump down. The welcome was done, I know Josh will agree, outstandingly by Mayor Moran. We're going to jump down to item 2 on our agenda, which is talking a little bit about the context of the 119K Commission. We want to kind of level set what we're doing here tonight, how that fits into what we'll be doing going forward, and then ultimately what we hope to accomplish in the end. So if we could go to the next slide there, Andrew. So as you can see here tonight, first meeting goal, very simple. Share context and updates about the 119K Commission. In a few moments, our co-chair, Mayor Carbone, will be talking a little bit about one of the other meetings that we had earlier this month. We'll learn from our invited panelists on poverty, homelessness, housing insecurity, and how these things are a critical component. They're just one component, but a very critical component of why 1 in 5 young people are considered at risk or experiencing disconnection. So what we're doing with these regional meetings, we're breaking each one of them down with a series of invited guests who can speak to a specific driver. And tonight that driver is poverty, homelessness, housing insecurity. So we'll be doing a heavy focus on that. But at the conclusion of that, we also want to hear from you and the public about your ideas on how we can help to get young people back on track. And a couple of points that I want to make, hopefully clearly, that are helpful in this. Number one, you're not limited to the topic of the night. Just because we're here to talk about housing, homelessness, and poverty, there are many drivers and many components to this crisis. And we would encourage those of you who want to come up and speak, we would encourage you to talk about what you want to talk about as it comes to the crisis with at-risk or disconnected youth. Also, you'll find, for those of you who are here in the audience, you'll find a little card on your chair that has a QR code on the back. That QR code will take you directly to the Commission website. Those who are watching at home can go directly to the Commission website, 119kcommission.org. And if you don't want to get up and publicly testify, you can submit your written testimony. If you want to submit comments to things that are being said throughout the meeting, or things that you want to add to what some of our panelists have said, please feel free to go either to that QR code, or again, if you're at home, go directly to the website, 119kcommission.org, and engage with us that way. I can assure you that your comments are all read. They're all curated. They're all an important part of this work, an important part of this process as we go forward. Now, that's just tonight's meeting. Tonight's meeting is a component of our strategy going forward of the full work of this commission. So we're going to talk about here in just a moment. We're going to change slides. This is like government work. You can't do government work without a PowerPoint. So, you know, this is like presenting a budget when you're sitting up here. We do have a couple of young CEOs. One of them, I think, is intending to be here this evening. He's not here yet. They might be able to do their budgets on Twitter or on TikTok. But us old dogs, we have to do things through a PowerPoint. So kind of the inputs for the strategy. The first thing is, as you can see, regional public meetings. What we're doing here this evening. We're doing these throughout the state, leading all the way up until the launch of a report. Roundtable discussions with young people. Talked a few moments ago how you're going to get an update from Mayor Carbone. We actually had our first roundtable discussion with a group of young people who are considered to be at risk earlier this month. Got a lot of good takeaways from that meeting. She'll provide you a little bit of an update on that. Testimony received that we just talked about through the 119kcommission.org. Again, all of that testimony is being looked at, read, considered, and ultimately will be helping guide the work of this commission and these commissioners. Local forums held by the commissioners. So even though we have these regional meetings, several of our commissioners on this panel are actually doing their own individual forums within their own districts. And we are doing what we can as a commission, both CCM as well as the Boston Consulting Group, to help guide that work, help support that work, and again, gather the information that comes out of those local forums that are held by our individual commissioners. Doing commissioner interviews, again, making sure that we have all of their input. They're the people who are going to ultimately have to pass these recommendations. So we're getting all of that stakeholders from our panel or our commissioners on this commission, as well as, you know, department commissioners at the state level, as well as, you know, others, as you can see in number 6, the stakeholder briefings. Because one thing is for certain about this, This is going to take multiple players and multiple stakeholders in order to be successful. And what we don't want to do, and what we won't do, is we won't have these meetings in a vacuum and then release a report that requires stakeholder action and all the stakeholders seeing it for the first time and saying, if you needed me to do this, why wasn't I part of the process? Why didn't somebody talk to me about it? I could have had some inputs. So this commission is really doing a heavy focus on making sure as we go along that we engage those stakeholders. So when the report is finally released, when the recommendations are finally released, they should not come as any surprise to any of the stakeholders, because the stakeholders will have their input. They'll have that back and forth with the commission, because really this is a giant tent that's going to take a whole lot of players. National expert briefings. For those of you watching at home and for those of you in the audience, again, through the 119kcommission.org, follow our schedule, because we will be meeting, the commission will be meeting with national experts virtually over Zoom and other mediums that other people will be able to go on and join and listen to. So again, those are not going to be done in a vacuum or done in secret. They'll be like a commission meeting, somewhat like a public meeting with some of these national experts, but it won't be us meeting with them in private. Many of these national expert forums will actually be done on a public forum that you can go on and register and listen to that conversation. And then finally, what got us all started here to begin with, which was the research that was already done, the research by the Boston Consulting Group. I want to give a particular shout out, as I think we always should, to Barbara Dalio with Dalio Education, who has done just yeoman's work in bringing us to this point to be able to have this conversation. And as good as the Unspoken Crisis Report is, which is an excellent report, I have a pretty sneaky suspicion, working both with Dalio and with BCG, that every bit of information that they gathered didn't make it into that report either. So there's already a lot of work that's been done in this space. So we're excited to take all of those inputs, all of those strategy inputs, and ultimately get to what the output would be. Which, here's the output, is a couple very simple but very important objectives. You know, for those of you who are followers of the Stephen Covey and the 7 Habits of Highly Effective People, what's one of the very early ones? Begin with the end in mind. To be successful, you have to know where you're going. You don't just get in a car and drive. You have a destination you're trying to get to. Well, here's the end in mind for this commission, which is to put 60,000 young people back on track. To take that 119,000 number and put together a series of actionable strategies that will put 60,000 of those young people out of their at-risk or disconnected columns and right back on track. And again, for that to work, we have to complete a process that results in stakeholders organized to advance the strategy's implementation. It can't be done in a vacuum, can't be done by mayors alone, can't be done by nonprofits alone. It can't be done by the faith-based community alone. It can't be done by, state or federal government alone. It's going to take a strategy where all of the stakeholders, many of which are already doing really good work, but are maybe doing it in a silo. It's going to take pulling all of those people together and getting them all rowing the boat together. And so that's kind of our path, our process. And as you can see, tonight is a very important part of that process. So with that being said, I'm going to kick it back over to Mayor Carbone, who can go to the next item on our agenda and talk a little bit about the youth roundtables that we just completed.
So, as you heard Joe say, the goal here is to hear from as many different sectors of our communities that are already engaged with the youth, who may be experts in some of their areas of delivery of services. But we also recognize that probably the most expert of experts in this conversation are the kids themselves. So developing this youth roundtable and creating a replicable model that other municipalities can take back and do in their own communities was the goal. We know that we did not want this to be a one and done. It wasn't just a box to check off. Okay, we did that. We spoke with 50 or 60 young people at the Waterbury Pallet Center. That's not enough. Because what do we know? We know that the reasons for disconnection are as unique and individualized as our communities are. So the reasons why somebody may be disconnected or feeling disconnected from their community in Torrington may be very different than New Haven or Hartford or here in Mansfield. So our goal was to develop a strategy that allowed these kids the freedom, the safety to be brave in what they shared with us. The things that we heard were, their concerns or their challenges or their successes in schools, jobs, after school or summer experiences, social media, social pressure, faith influences. And one of the more profound things that that came out of this was when we talk about influencers. For those of us in my generation, they were people. What did we hear at this conversation? It was Google. It's TikTok. It's people that are not real in their life. And that's a profound thing for us to hear. So we are developing this model that can be repeated and brought into each of the communities for the commissioners. I'm looking forward to delivering one in Torrington. I brought one of my friends from the city of Torrington who's already been working with families, talking about what will this look like for us, and how soon can we get it off the ground. Intentional engagement, being a part of the process. Those are the messages we want our kids to hear. So again, I'm so proud of the work that this commission is doing and so grateful for the opportunity to be a part of it. So at this point, I think we're moving into panel discussions. Am I 6:20? 6:19. I'm giving back a minute.
Timely, very timely. For folks who are watching at home, you should know that tonight in Mansfield, Connecticut, we have a full house. We have a full house of people here tonight because we all, I bet I can speak for everyone who's come out tonight, all believes in the incredible potential in every young person, in their talent, in their dreams, in the opportunities that they deserve. And I think we also all believe we have an opportunity ourselves. We have an opportunity to work together across town line, across party, across sector, across whatever way we want to otherwise divide ourselves. We have an opportunity to work together. And we have an opportunity to work together to address what is a statewide crisis in Connecticut. A crisis in how our systems are not serving all young people well. This is a crisis that impacts every town and every city in this state. 119,000, 20% of all young adults in this state between the age of 14 and 26 are either at risk of not graduating high school on time or have already disconnected from education and employment. That's 1 in 5 of all young people between 14 and 26 years of age. That's 1 in 3 of all high school age students, 56,000, who are at risk of not graduating on time. That's 63,000 young adults who today live in this state but are currently not in education or not in a place of employment, when we have a labor market with more than 100,000 unfilled jobs. When we use terms like at risk or disconnected, I also want to be very clear, we're not talking about the young people themselves. We're talking about the context or the condition in which young people are growing up in this state. We're talking about a temporary circumstance that together, we and they have the power to overcome if we choose to. And so that very much is the mandate of this commission. It's to work together and it's to listen. For the remainder of tonight, however long we all want to be here, our job is to listen and to learn and to hear your ideas. We started with the first regional meeting in New Haven at the end of last month. And we focused, as Joe said, on the theme of systems at local, state, and federal level, and how systems could work better in support of all young people, and tried to listen to concrete ideas or solutions for ways in which stronger collaboration can happen across systems. We learned a lot. What we learned will shape what ultimately the strategy is that is produced by October. Tonight, we're focused on poverty, homelessness, and housing insecurity, because I think we all know, because we're here tonight, that they are really important, significant factors contributing toward the reality in which so many young people in this state are currently experiencing disconnection from education and employment. We know that there are tens of thousands of young people growing up in Connecticut today, growing up in poverty in a state with such abundance of resources. And we know that young people who attend high poverty schools in this state are 2 times more likely to experience disconnection from education. We also know that young people experiencing homelessness or housing insecurity are 3 times more likely to experience disconnection. And we know that there are thousands of young people who are currently experiencing homelessness or housing insecurity in Connecticut. You'll hear tonight about numbers, but you will also hear that the numbers are an underrepresentation of how many young people this very night, in this very state, do not have a warm home to go to tonight. Tonight, we are lucky to have with us 6 invited panelists and so many members of the public who are here to share their ideas around what we together can do to address this statewide crisis. The way we're going to organize the panels is in 2 different panels, each about 40 or so minutes. Each panel will start with a presentation from the invited panelists, and then we'll have an opportunity for dialogue with the commissioners who are here and the panelists themselves. For the first panel, I'll introduce them, we'll go through their discussion, and then we'll introduce the second panel. For the first, we are lucky to have 3 incredible people with us. First is Angel Cotto. He's a researcher from the Youth Action Hub, which is a youth-led participatory action research center. The Youth Action Hub's expertise in housing insecurity has driven their work around issues surrounding youth, education, housing, and employment with a focus to improve the lives of Black and brown queer people. Angel is dedicated to raising the voices of Connecticut's most vulnerable and marginalized communities. He's joined by Jackie Santiago to his right. She's CEO of Compass Youth Collaborative, where she and her team focus on interrupting violence in the city of Hartford by building transformative relationships with young people. Jackie and her team work directly with young people who are growing up in poverty and who are experiencing homelessness or housing insecurity, and they are incredible champions for young people. And certainly last but not least of the panel is Stacy Villante-Cote. She's Deputy Director of the Center for Children's Advocacy, where she advocates for youth experiencing homelessness or youth who are at risk for homelessness. Stacy works closely with youth and young adults and statewide partners to remove systemic barriers to youth accessing safe and stable housing. We have a lot to learn from these 3 invited panelists, and I turn it over to you to lead us through your discussion.
Can you hear me okay? All right. Well, thank you to all of you who have come out tonight to hear from us. Thank you to everyone in the room for being here, and to those online. We are eager to share. Got it. Thank you. Okay, thank you. So we are eager to talk with you all about homelessness and poverty, and we will jump right in. We thought the first thing we'll do is a little bit of level setting, give you a little bit of data, but not too much, just so that everybody has a sense of the scope of what we're talking about here. So we wanted to start with school district data. I'm not sure if you're all familiar, but all of this data is available right on the State Department of Education's Ed site. So you could look up your own individual districts if you haven't already. We always encourage people to be doing that and engaging with homeless providers in their community about the numbers, because the numbers are only as good as what is tracked and reported. But to give us just a starting point, for the 2022-23 school year, there were about 5,000 students experiencing homelessness. And so this includes students who are on their own, which we'll talk about in a moment. This includes students with families. This includes students in shelters. This includes students on couches, all of those categories. Particularly concerning is the 82% of students experiencing homelessness are students of color. So make no mistake, we're talking about a race equity issue. The primary nighttime residence for most students experiencing homelessness is doubled up, which means that they are on couches, on the floor, on pull-out beds, crowded rooms, basically doubled up with somebody else because of their loss of housing. That's the biggest category in Connecticut of students experiencing homelessness. And then we have students who have learning challenges, whether that's because they have a disability or they're English language learners or multilingual learners, also experiencing homelessness. So we have those categories at 28% of students experiencing homelessness having disabilities and 22% who are English language learners. This last category is a particular passion of ours. This number of unaccompanied youth. Under the federal law, that means students who have been separated from their parent or guardian. Their parent or guardian may also be experiencing homelessness, and maybe some of the family is staying in one place and this student has been separated. It could also mean, and we've had plenty of these scenarios, where the student is not in touch with their family at all. Their family may be in the state, their family may not be in the state. And this particular number is the biggest area where we see an undercount. And what young people tell us is they don't want to tell anybody that this is their situation. They have fear of child protection services. They may have siblings who are still with their parents and they don't want to get the rest of the family in trouble. They may have shame. And they also don't know their legal protections to stay in school. And so we have some recommendations around that we'll talk about. But this number is really concerning to us in the fact that we believe it to be a really big undercount. So the last time that Connecticut as a state did a particular count for youth experiencing homelessness was in 2020, pre-pandemic. The findings came out just after the pandemic started. The count was done in January, so this is completely pre-pandemic. But this statistic that we show you here of about almost 700 minors 17 and under experienced literal homelessness in 2020. Literal homelessness being in a car, on the street, in an abandoned building, literally no place to be. Almost 700 in 1 year, estimated. That's shocking to us. That's a shocking number that we should all be concerned about. This data that we're showing you here, also from the 2020 youth count, really just gives you a broader look at the population. Almost 8,000 young people who were on their own, experiencing either unstable housing or literal homelessness. And so you can see the 18 to 24-year-old population, and you can see the population of minors in these numbers here. And we think that those are important distinctions. The systems for the 18 and over population are very different than the systems for minors or lack thereof. And distinguishing the remedies and the experiences of those two populations is important. So when we talk about homeless youth or young adults, we want to make that distinction between those populations. And so I think the last thing we want to underscore is something that Andrew Ferguson said earlier, just the strong connection between homelessness and disconnection, and that it's an important subset of the population. So we appreciate you taking these comments and thoughts on homelessness from us.
Thank you, Stacy, for doing some of that level setting for us. So as Andrew mentioned, we're going to be talking for about 20, 30 minutes, and then there'll be some Q&A as part of that. And so before we really jump into talking about all of the issues and recommendations we have as a group, we wanted to talk about two important or overarching values that we have as a group, as people who work in housing, who work with disconnected youth in general. And one of them, as Mayor Carbone mentioned, was working and really partnering with young people with lived expertise, having these conversations with these young people, making sure that they are part of not only creating the solutions but also implementing the solutions. As part of all of our organizations, we have either worked with young people, done research with young people, have employed young people with expertise to conduct research, to be a part of these conversations. We have young people as part of our committees. We have young people employed at all of our organizations who all have lived expertise. And as Carbone mentioned, we really believe that to find the correct solutions, to find the best avenues to reconnecting these youth to the resources that they need, we have to continue to listen to young people with expertise, continue to partner, pay them to do this work, or just and let them lead the work as well. And so, in many ways, we have been able to foster that in our different spaces. The other overarching value that we have is just race equity in general. We want to make sure that we include that in every piece of the conversation. We are going to be talking about a lot of different systemic issues, a lot of issues that are really important to us, a lot of issues that are, a lot of young people are facing, and we want to make sure everyone is thinking about that in a race equity lens, thinking about Black, Indigenous people of color, thinking about people of different sexual orientations and gender identities, and so many more marginalized communities that are impacted in compounding ways through a lot of the issues that we're going to mention. And one of the things that we consistently do is look at data, looking at entries and exits for people of different identities, and seeing, how are young people specifically of different identities, how often are they coming into the system, how often are they receiving the services that they need, and how often are they leaving the system without receiving what they need. And so those are two major things we want to make sure is still in everyone's mind. Like, all the work that we do is through a race equity lens. All of it is working with young people with expertise. So on that note, one of the first big topics, as you can see on the screen, is improving data. And so Stacy did already give us a really good introduction to what data is available in the state. And I wanted to ask Stacy if she could mention a little bit more about what are the current gaps and needs for more accurate data, more information. We already saw a lot of really scary, daunting facts on that screen, but what don't we know? What else should we be looking at?
Thank you, Angel. So one of the two recommendations we have around data, one is that the youth count data that I spoke about earlier, as I mentioned, is from 2020. We need to redo that. We need to see where we are. We've all been through COVID. It's been 4 years. We need to see where we are. The state does do an annual point-in-time count of homelessness. However, I think we could all agree that youth homelessness looks different than other forms of homelessness. And you saw that number of the number of folks who are doubled up. And so really getting at that number and what it looks like, what we can say about race and ethnicity, what we can say about young people's in terms of sexual orientation and gender identity who are experiencing homelessness in our state. We need to redo that data. The second thing that we would say is around school identification of students experiencing homelessness. We think that it can be attacked on multiple fronts. Number one, training, school staff at all levels, at the front desk, in the classroom, in the central office, in the phys ed teachers, in the coaches. Those are the people that students are likely to talk to. Those are the people, if they understand the signs and symptoms of homelessness, and if they understand the legal rights of students experiencing homelessness, they could help to stave off some of that moving around and students not wanting to talk about their experiences. I can't tell you how many football coaches will contact me and say, I got this kid, he keeps not being able to come to practice because he's moving around so much. I only know because I keep asking him why he's not at practice. And so at all levels of the school experience, the more that people know that students get to stay in their school while they're moving around, that students can get the transportation, that they're not going to be kicked out of school because now they're staying in another town. And last week they were staying in a different town. So we really think that training is critical. And then for students and families, the more that they understand their rights, the more that they're sharing it with their friends and with people they know. And so we're going to talk a little bit later about a particular pilot, but student ambassadors, really important. That's who young people listen to more than me, more than any of us. They listen to their peers. And the State Department of Ed, if you're not already familiar, had a whole campaign called No Matter What. And all of those materials are available online. They can be used in schools, but the message is to students. No matter what, no matter where you are, you could be in school. And so those materials are available and helpful for spreading some of the word.
Thank you, Stacy. And I definitely want to mention too, all the conversations I've had with young people who, you know, there are so many great services that you just mentioned that are out there that young people are still being missed by the mark and falling through those cracks. Like myself at a very young age of 16 years old, not knowing about McKinney Vento liaisons and doing the research through the Youth Action Hub. Like there are so many folks who are experiencing housing instability in their teenage years in high school who don't know these McKinney Vento liaisons exist, don't know their rights, and we've done so much work to create these solutions. So we need to make sure we're pushing and having the resources to make sure everyone knows about these resources so that young people aren't falling through these cracks. I know another thing we really want to talk about is how system improvement is critical. And when we think about systems, we're talking things about mental health, we're talking about income, affordable housing, childcare, discrimination, and all these barriers are compounding and how persistent they are. And two of the big things we think is really important to talk about today is access and transportation. And when it comes particularly to access, we have such a robust like housing system that does so many things well, and unfortunately one of the biggest barriers is that we have a single front door to the system as a whole, which is our 211 system of calling and getting your CAN appointment to essentially get any type of housing resource. And so we're constantly having the conversation of what better ways are there to access, because people are having either negative experiences through different things or through 211 and are refusing to use the front door of the system and are essentially just not even being seen by our system, because if they're not excuse me, counted in our system, if they're not accessing services, we don't even know that they exist. And so I know one of the solutions that we talk about when we talk about access is like meeting young people where they're at and finding different ways, including innovative ways to really reach people. And so one of the things I want to talk about that Stacy and I really are very passionate about is the virtual drop-in center idea. And this is a model that is something that is a pilot study at the Youth Action Hub and can be completely done in different ways. And so we don't have anything to show, whether this idea, how it could work, but we do have, conversations and information from young people that we've done studies with to talk about a one-stop shop that has everything a young person needs, a place where they can go not only to hang out and talk to other peers, but also to talk to providers, talk to mental health experts, talk to just basically anyone in their potential areas, whether that's locally or statewide. And so the virtual drop-in center is not only a space for people to, find resources and either like whatever's on 211, whatever's on other places from a virtual space. It's also a place where young people are the experts to what resources are current, what are actually working. And, we hear a lot of the times, and one of the issues with access is, we give referrals out to young people. And when they call that place, when they go to that place in person, it's either closed or the hours are different, or they haven't been providing that service for X amount of years because there's no longer any funding for it. And so we know that young people are really the experts into what's currently exists because they're using it, they're finding it, they're doing it. And so creating spaces where young people can have access to providers, but also to their own peers to see what's currently working. But also we talk about often at the Youth Action Hub of using this as a radical self-care model where mental health is a really important piece to all of this, where everyone wants a space where they can come as their whole self. When you go to a physical drop-in center, you're going there with the knowledge that everyone who sees you going into that drop-in center, there's a stigma. You know, you're either experiencing housing instability or you're experiencing something else. Like there is this weird feeling of going and using these spaces. And so with a virtual space, you kind of are usually safer from those stigmas from people seeing you there. And so along with that as well, we're talking about coming in as the whole health, as your whole self. Like there are things that people go in there for to just have conversations with their peers, have conversations with providers. Really, all of the things that you do when you go into a physical drop-in center, you talk to people, you have conversations. It's something that everyone needs. And so, I won't go on forever about that, but that is one of the solutions that we are talking about is finding other access points, whether it's a virtual drop-in center, whether it's some other form of virtual means where someone can come in and get all of the services they need in one spot and talk to peers of their age and find out what's working for them. That's one thing we're thinking about. And then I'm gonna ask Stacy to talk a little bit about the minor community care teams. Pass this on to you.
Hope you don't mind our back and forth, but that's just our way. So we've been piloting, as I said to you earlier, we're really thinking about what remedies there are for minors experiencing homelessness or housing instability and what works for young adults. And so we've been piloting these, what we're calling community care teams for minors. We have about 4 in operation right now in Bridgeport, in Manchester, in the New London, Norwich area, and we're about to launch one in Hartford. And basically, this is for young people who are minors who are not fitting into the child welfare system. Either there's the child welfare system is saying there's not enough legal authority to take them into care, or the family is saying that person can come home, and the young person is saying, I don't want to go to that home. I don't feel safe there. And what we know is that these young people have traditionally had to go from program to program to get their needs met, whether it was an employment program, an LGBTQ support group, a mental health program, and minors getting transportation to these programs and accessing them has been challenging. So we created this youth-driven process that young people helped us design, where we bring all the providers into one space and young people are driving what they say they need. So they have an ability to check off, I would like this service, I really need employment, I would like mental health counseling. We take what they've told us to this group of providers, and we have a case conference that's de-identified. We have a process for contacting parents under the law, and we are bringing the services to bear for what the young people have told us they needed. These are currently unfunded, and people have been coming together on their own to just do them because they have been serving minors and they get frustrated doing it on their own. So coming together in a group, the providers have enjoyed that solidarity of talking to each other about best practices. This program would be enhanced so much if we had more youth ambassadors. In Hartford, we were able to get stipends, so we've hired a young person who is gung-ho to go out there and tell other young people. He's texting me, I found another person who needs help. And it's really through those connections that I think that we can have a better safety net for minors experiencing homelessness, or housing instability is what it often looks like. And it's often intermittent, and it's often where they're staying at somebody else's house for a period of time.
I want to finally give Jackie a chance to talk. I know we had some really robust conversations in our prep meetings about some of the barriers to transportation and some potential solutions. I know I have a few ideas that I want to recommend, but I wanted to give you a chance to kind of talk about what you've seen and the work you've done, where, like, what issues around transportation have really compounded the issues that you're seeing.
Absolutely. Thank you, everyone, for the opportunity. Our youth are truly disconnected. When you talk about youth who have been at the center of violence, these kids really experience many different risk factors. Housing being one of the major reasons why they are disconnected from school. They're unable to really seek employment. And then when you think about transportation, in terms of transportation, I can't tell you
the amount of money that our agency spends on just transporting youth, whether it's a mentor transporting them safely in their own vehicles, or now we've resorted to using Ubers to take people back and forth because transportation via the bus systems have not been reliable, have not been safe for youth from different neighborhoods. And so really having that opportunity to make sure that youth are able to navigate different opportunities within their cities is really critical. There aren't also a lot of opportunities that are within Hartford themselves. And sometimes when you think about kids going to Enfield, to Amazon, or at 2, 3 in the morning, finding whatever jobs they can, it's been really difficult for youth to have that reliable transportation. And so that's one key issue that we need to look at.
Jackie. A few things I also just want to mention when it comes to transportation is the work that's been being done with the Juvenile Justice Policy and Oversight Council. They've really highlighted transportation support as really a critical for youth reentering from incarceration. And two of the recommendations that we've talked about specifically around transportation when we talk about, what currently exists in the infrastructure in Connecticut is, we've often talked about the fact that the UPass exists for a lot of community colleges around Connecticut. And for those who don't know, it's a pass that you get for attending a lot of the community colleges in Connecticut. It allows you to use free transportation on any of the buses or trains across Connecticut throughout your entire semester at that college. Why does something like that not exist for people who really are, at risk of all of these different experiences, who are disconnected, who are experiencing housing instability, some form of consistent free transportation to get to work, to get to the places that you need to pick up your children, etc. And the other thing I wanted to mention as well is I'm recently hearing about the work that's being done with United Way with the Department of Transportation around creating like local, just kind of avenues for transportation. And so I don't know the specifics around that work that's happening over in the eastern side of the state, but if the Department of Transportation is creating local areas of transportation outside of the bus system, outside of the train systems currently, as we know that it's not a perfect public transportation system. There's so many areas in the state that no one can really access transportation, even if it's free and affordable. What are we doing? What conversations are we having to create spaces outside of just the buses and trains? And so I would like to transition us to our next piece of the conversation where we're really talking about, all of these different types of barriers are just kind of compounding issues for young people who already have a lot of issues happening in their personal lives and really need a lot of different types of supports from either the schools that they're going into, the programs that they're a part of, or just like the adults in their lives. And so I wanted to hand it over to Jackie to talk a little bit about like the need for different types of life skills and what that means for young people.
I am truly an advocate for high-touch case management. At the end of the day, these resources do not come alive. The youth do not know how to navigate opportunities until they have someone helping them work through these situations. We have lots of barriers that the youth overcome when they're trying to access resources that they need support with. And so oftentimes what we see is we're giving them instructions on how to do these and not recognizing that these youth already have lack of access to basic needs such as housing and transportation. And on top of that, we layer trauma as a part of the dynamic. And we have people that are not able to really access these resources in the way that we think that they should be. And so we have a start line, but the reality is that for many of these disconnected youth, they are way behind that start line. And we make it so difficult for them to even begin. For instance, our youth are told they need to bring their social security card, their date of birth, they need to bring all of these documents, they need to be there consistently when they do not have the access to do it. And so they really need these mentors, case managers to help them navigate these obstacles. In addition to helping them navigate these obstacles, also these trusted mentors are the ones that are teaching them these life skills and teaching them how to build for the future and get to that start line. So we're often teaching things like self-regulation from the very beginning. That is really key for us and our program. Teaching them about communication skills, teaching them some of the more difficult skills of budgeting and navigating those obstacles. But it's really about a relentless approach to this work. I think oftentimes we're looking at this and saying, all right, they got 3 strikes, they're out. There's 0 tolerance for this stuff. And I don't believe in that language at all. If we're talking about true disconnection and we're talking about people that have been traumatized and have lack of access to things, then we need to figure out how to get them the resources that they need in a way that is palatable, that is understandable, and that they can learn how to get these skills for themselves because they're already on an uneven playing field. So with that, I'll turn it over to you because I could go on forever.
I hear you. And one thing I just want to add to that as well is we have a lot of services in the housing world to get young people connected with case management, and there's a lot of different really helpful services where it's like case managers can call for appointments for you. They can really just give you referrals, connect you to so many different things that you need, and even like drive you to places that Jackie mentioned. What happens when you're in a housing program for 9 months? They're paying your rent and they're giving you all of these services, and then you discharge successfully because it's been 9 months, you have a job, and then all those life skills that person was, providing to you, all that support, all that help, all that guidance to someone who is probably traumatized, who probably doesn't have family connections, other friend connections, that one kind of lifeline important person they had in their life is just gone now. And now you're like back to kind of a square one where it's like, if you didn't learn all of those life skills, if someone was just helping you and supporting you, what do you do after that 9 months ends after that program? And so one of the things we constantly hear from young people is that there needs to be some kind of check-in, some kind of services after leaving programs, at least someone you can call, someone you can reach out to provide you with any assistance when you are, supposed to be, stably housed after the program. But in reality, you're one bad thing away from just being homeless all over again. Yeah. So the next thing we have on here is for innovative ideas. And so one of the things that I know we're talking about different ways to reach young people and reach them where they're at and let them really kind of be the change makers in their lives and really have the autonomy to tell you what's needed the most. And so I think of that when I think about this idea around direct cash transfers, and I'm going to give Stacy a moment to talk about that.
So there's this innovative idea that's being piloted nationally in at least 7 different communities. And the idea is that for the 18 and over population, you give them money directly to be able to solve their own homelessness. They have a menu of options of services, and the young people say, this is the service I need, this is the one I need, this is the one I need. They get a monthly amount of money to be used as they need to be able to, if their biggest need is a training program, to be able to access that training program. If their biggest need is a safe crisis housing, then they could access whatever feels the most safe to them. But these have been piloted nationally. The Chapin Hall is currently evaluating the pilot in New York City. There's been a lot of money put into that pilot. The interim results are positive, and I think we could learn a lot from targeting a specific population and providing direct cash for a period of time to be able for young people to decide what they need to get out of their homeless situation. The program broadly is called direct cash transfer to youth and young adults experiencing homelessness.
I'll talk briefly about this because it's not, in my opinion, really an innovative idea. But when we talk about crisis housing and shelter, I feel like everyone can have an image of their mind of something that's probably not the most pretty thing. And if you have more knowledge about what crisis housing exists in the world, in the state, you can think of things that have a lot of rats, that have beds that are not the best, of people feeling unsafe and feeling like, honestly, sleeping on the streets or sleeping in a tent might be better than the crisis housing we have available in Connecticut. And so, really, we need to pour more resources into our crisis housing. We need to create better crisis housing, not only for just people of all ages and all identities, but definitely I want to say like our LGBTQ plus and queer populations and our young people especially. You know, a lot oftentimes they are not entering shelters because like who wants to enter a shelter when they look like that, when you have all of these negative experiences, when there's so much stigma around it. And we really need to start counteracting the stigma around what crisis housing looks like. And definitely one of the statistics I really want to talk about is that, you know, LGBTQ plus folks in general are 2 times more likely to have early deaths, and trans people, and we're not even talking trans people of color, but trans people in general are 4 times likely to have to experience early deaths. And so there are some innovative models nationally. One of them is the Y2Y shelter that I believe is through, I want to say it's either Harvard or Yale, but essentially it's looks very kind of like an open, friendly space. The showers are all closed up. There's computers to be used throughout the day. They don't have a very like hard time to just like kick everyone out. Um, there's time to be there, to be a person, to look for employment, and like all the beds are as well are like you have places to lock your stuff up and everything. And so I think of models like that when I think of the crisis housing that we need for LGBTQ plus individuals and also just young people in general. You know, we're going to continue to not see these people enter our systems, and we're not going to be able to count them or know what the experiences they're going through until they are comfortable enough to at least pick up the phone and go to one of these shelters.
I want to speak on two different ideas that I have. One of them is like strictly my idea, because of all that I've seen in the in with our youth involved in violent situations. And I think it's really imperative to create safe environments for our youth. I often wonder, like, if their homes are not safe, what are we doing for them? What are the alternatives? Is it just a DCF bed, or can we do exchange programs? Like we have them for youth where they go to, my child went to Denmark, and someone from Denmark came to my house. Are there opportunities where we can create warm handoffs to someone in another community that could give them a fresh start? The idea is that we may have the resources, but we just don't have a safe location for them to go to when they're the target of violence or when their lives are in danger. So that's one of the pieces. I also think that it's really important for us to examine that time period between 18 to 24 for those youth that are not going to college. You know, college is really that opportunity for them to learn and have someone holding your hand. You're out of the home, but you're not all on your own. Usually in our communities, our kids at 18, it's bye, go do your own thing, figure it out. They don't have the resources. What is that for youth who have to work, who cannot afford to go to college? What is that? Who's holding their hand, and what programs are we developing for them to learn how to transition into adulthood during that time? So I think that's an area to explore. And then just better coordination. This is not innovative, but we have to have better coordination between the services that exist so that youth know where to go and how to get supports within their own community. I'll lastly say that we're talking about poverty at the core of all of these things. And I think when families can't get paid for sick time, or anything like that, they really struggle to care for their loved ones, especially if they've been a part of a serious illness or impacted by violence. And essentially, we don't have a way for them to get the care that they need, get the money that they need while they're caring for their ill ones.
I'm gonna pass it on to Stacy to talk about municipalities as critical partners.
I know we're coming close to our time here, so I'll be clean up batter and get through this last bit. But I mean, we couldn't resist the opportunity to talk about the roles that you all have in your municipalities in addressing youth homelessness, and we think in addressing youth homelessness addressing your chronic absenteeism numbers and your disconnection numbers. One is this idea that I know was spoken about in your last forum around creating regional teams, and similar to the homeless system, having a regional team around disconnected youth. The ability to connect your municipal resources, your libraries, your rec centers, your after-school programs, your violence prevention programs, whatever it is you're spending money on, the ability to connect them all to talk about a list of disconnected young people, the way that in the homeless system we have what we call a by name list of people experiencing homelessness, having a similar list for your services to be able to plan around and case conference around. We think that that tracking of those numbers, the demographics and the outcomes is an opportunity. We also think, as I spoke earlier, about increasing school identification of students experiencing homelessness. That number of unaccompanied homeless youth should be going up, not because we want to see more unaccompanied homeless youth, because we know they are experiencing homelessness alone and they're not telling anybody. So those numbers should be going up in each and every community. And I think some questions to ask of your school districts. Does your McKinney-Vento liaison, who is the person who is charged by law to provide services to students experiencing homelessness, does your McKinney-Vento liaison have sufficient capacity to meet the needs of the students experiencing homelessness? Does your district have the mental health supports for students experiencing homelessness or disconnected? And do you have the resources in your schools for basic needs of food and clothing? We know that students, the more they can get at school, the more that they can overcome some of those stigmas, increases that connection. So with that, I think, Angel, you close us out.
Did you want to think checking? Yeah, I think that is everything we really have to share for you. And so, I'll say it aloud, we really need to improve data to know what young people are experiencing, who's in our system, and who are we missing. We all know that there are so many system improvements that really need to happen to connect folks, long-term supports, and there's a lot of innovative ideas to invest in, but municipalities definitely as critical partners is something big, because when we talk about young people experiencing housing instability, experiencing poverty, experiencing violence, they are not just going to go seek out just people in the education field and just like their teachers specifically. They are seeking out whatever trusted adult is in their life. And so making sure that, any person who is encountering a young person who's disconnected or experiencing any of the things I just previously mentioned is equipped with the tools they need to connect that young person with what resources, what services we have here in Connecticut. So I think that is where I'll leave us to go into Q&A.
Thank you. Thank you so much for sharing your time and your wisdom with us and your powerful ideas and being so concrete in many of the both opportunities and solutions you've offered. Let's spend a few minutes with questions from the commission.
Thank you, Mr. Chairman. I'm always reluctant when we're talking about at-risk and disconnected young people to bring up COVID, because people think that that's, some major driver, when in fact we know that this existed long before COVID. However, with that being said, I've also seen, as it applies to homelessness, Connecticut was doing a really good job for over a decade, maybe several decades. We saw the prior administration under Governor Malloy put a major focus on veterans homelessness and basically, I think, eradicated it at one point. We saw our homeless population really decline all the way into 2019 statistically into, I don't want to say nominal numbers because they're real people, but something we could celebrate as a state that we were heading in the right direction. And then we saw statistically a major shift where for the first time in over a decade that our homeless population spiked fairly significantly and then continued to rise the year after that. And so I guess my question is that all that shift in that trend, is that all COVID related, or are there other factors that took place that saw us go from being a state that looked like we were really getting it right to seeing major shifts in the wrong direction?
One piece of information I'll just quickly add to that. We were doing a great job, I would say. The goal to end youth and adult homelessness back then was March 2020. And I'll be frank, we were not going to reach that goal, but we were very ambitious and we were very close to getting the numbers to being rare breed in one time. And so we haven't even been able to have the conversation of what that looks like again since the pandemic. Having homelessness be rare breed for one time again is not like it's still a goal. It's just not, we don't have a date in mind anymore. But I think you want to say something.
I know that there's people in the audience who have thoughts and expertise on this as well. So I expect that you'll hear more in answer to your question this evening. We can't approach this conversation without talking about affordable housing and the ability for a young person to be able to afford rent, to be able to access stable housing is beyond their reach right now. And so affordable housing across the state for families, I expect folks in the next panel will feel the same. We have to address the affordable housing issue in order to get to a place of homelessness being solvable again.
Madam Chair. Stacy, I'd like to ask you a question, and Angel and Jackie. I'm Mike Frieder from the town of North Haven, and under Category 5, municipalities are critical partners. Thank you, by the way, for the 5 recommendations. That's our area of expertise, of course, providing services to our residents in our respective municipalities. You mentioned something, Stacy, about providing a list of all those services. Each of us here and all of our colleagues across the state, we have a lot of the same services, but depending on the size of our municipalities, we may offer more services. So under that category of providing a list under this regional partnership, where would the repository go of the list of all the services that our municipalities have on a region by region basis so that people can access those services?
I think you probably have some thoughts on this as well, but I can start. So thank you for your question. A couple of things. One is I do think that each municipality or each region, however it works in your area of the state, could have a list of young people who are experiencing disconnection. So that's I think an important system that could be implemented so that folks are talking about the same young people to access these services that you have in your communities. And then Angel presented a little earlier about this innovative model of having virtual services available. And so I don't want to speak for him, but I echo that importance of having the services available virtually and in as many places as possible. So it's not one place, it's virtual, it's with all those folks in the schools, and it's accessible with a QRL code, it's accessible in a multitude of ways so that young people have that connection. But I do think that convening the folks to be able to offer the services that a young person has said that they need is bringing everybody around that young person. So I wouldn't think about one without the other, in my opinion.
I have a question. I'm Josh Brown.
Oh, yeah, I'll quickly just add to it. If you're talking about a list of like resources and what's available, and like you put that list anywhere, whether it's virtual, whether it's on a website, people aren't going to access it. It's just not going to happen. We have a 211 website that has so many resources on there. As soon as you see 10 plus resources, you're overwhelmed, and that is an experience that not just young people have, but everyone has. If you have to call 211 and you have to call for a resource, to call for a resource, to call for a resource, that the momentum is going to stop there. And so the solution I think of when I think about that is having better partnerships with the people that we have locally, with our providers, with our people doing the work, and making sure that we can have meaningful handoffs, and just making sure that when we're talking to young people, when people are asking for services, there is a place that we all know they can go to. And so if that's locally, they're asking a teacher, that hopefully that list of resources, there's someone within that school district they can go to ask for help and help them, guide them to the next step. Because if it's just here's a list of everything you can possibly call or look into, that's where the momentum dies right there.
It's all about relationships, is what I'll add, is that, really it's about creating that ecosystem of supports that are going to help youth navigate the systems that are in place. And so I'll echo Stacy and just say training, lots of partnership, lots of relationships.
Oh, hi. I'm Josh Brown from Domus Kids. I'm one of the co-chairs. When I'm looking at the school district data, it's 5,100 kids that we see that's in the school district. So this is those that are actually in school that's being counted, that's being tracked. How many young people do you think that are not being tracked that should be in this number? Because I know it's 5,100 that we're saying that's in the schools, and there's many that's just not in school, fell through the cracks. What do you think that number looks like with those that are not being counted? How many young people do you think are experiencing this that's not in this count?
Yeah, I think that's part of the problem, is that we don't know. And I think the answer is definitely, it depends on what type of housing instability you're talking about. If you're talking about the doubled up and some of the experiences that we know many of our young people are facing, that number's definitely in the thousands. If you're talking about literally homeless, I don't know if you would say hundreds or thousands, but I think that's the problem, that we don't know the answer to that question. And so, we're guesstimating, and Stacy might have some thoughts on what the numbers could be, but I don't know if we really have that idea without actually having the data.
I will just say that the last data we have is from 2020. And
Right.
So we have the number of 7,823 of minors and young adults experiencing either literal homelessness, again, no place to be, or housing instability. And those are our 2020 numbers.
And I actually was part of that, doing that youth count in 2020. So the last question I had, the unaccompanied youth, I know it's 371. Are we actually counting those two that are, because we're 13 to 17, if they're not accompanied by an adult, where are they in foster care? Are they just literally neglected? Just because if we're saying unaccompanied and they're from 13 to 17, I understand the 18 to 24, but 13 to 17, that's just not accompanied by a parent, a guardian.
So I'm glad you asked, because this is a particular term under federal law, the Federal McKinney-Vento Homeless Assistance Act, that says a student is unaccompanied when they're not in the physical custody of a parent or guardian. So they may or may not have a relationship with a parent or guardian, and they are moving around. They are on their own. Their parent may be involved, but not able to be physically with them because they've lost their housing and people separated. Or they may not have contact with their parent or guardian. A young person that I've been working with for the past couple of years, his parent up and moved to another state. And he was here with some friends, and that worked fine for a short period of time, and then it didn't. And he was on couches, and finally he couldn't be on couches anymore. We paid for him to be in a hotel for 2 separate weekends because he had no place to be. And finally, we got him into the homeless system, and he's in a terrific youth homelessness program now. So it looks like different things, but they are physically separated from their parent or guardian.
Thank you.
Good evening. I want to thank the panel for all the work that you do on the ground. I am Danielle Wong. I have the pleasure of serving as mayor for the town of Bloomfield. Our school system is predominantly Black and Brown students. We have roughly under 2,000 children that attend our public school district. So this is very concerning as it relates to how to attack this particular issue in my particular municipality. So I really want to thank you for offering and suggesting concrete solutions that I'm interested in doing some more research. But my question is around when it comes to the identification and training up our faculty and our teachers. And I want to kind of pick your brain on the approach that you would offer in an environment and in a time where teachers and our faculty are so much underwater when it comes to capacity and their own mental health issues. And some of them are actually leaving the industry because of the compounding issues that are often put on their laps. So I just wanted to see what your approach would be as far as implementing some of these solutions that you've offered into some of our school districts as it relates to training and identification.
I'll add a quick thought to it. What Stacey mentioned around the McKinsey event liaisons is just making sure that we have the resources for that, and just that they're connected to their school districts, to everyone in there. Every teacher, every faculty member should at least be aware of the McKinsey event liaison, and so if a young person talks about the experiences that they're having, whether it's homelessness, whether it's housing instability, or something else, and the McKinsey event liaison is a relevant person to connect them with, and that connection that could be made. And so you mentioned like everyone like lacking capacity, and so we really need to make sure that McKinney Vincent liaison isn't lacking capacity, I think, is the solution I would recommend.
Kudos to you as well for all that you're doing. And we know that the schools and the teachers are already taxed with so many different things. But I do think that the teachers have the greatest vantage point, or the greatest benefit, because they are the ones that are establishing relationships with these kids day in and day out. If they're building these relationships, likely the youth will come to them and tell them about any situations that might happen. And maybe it starts with providing the resources so that they're aware of what's available. I do think that I'm a very strong proponent of having partners within the school as well. If you have community agencies that can help partner with that to be able to provide some of the resources, or at least the coordination, that may help a little bit as well.
I think the last thing I'd add is the teachers have to have partners in the rest of the folks in the school building too. And whether that's, as I mentioned earlier, the coaches, whether that's the school nurse, whether that's the social workers, rounding out that knowledge means that the teachers aren't the only ones who are aware of the rights, the responsibilities, and the services and access to them. And what teachers have said to me is knowing that the student is experiencing this and being able to bring that to light has helped engage with the student and lessens a little bit of the frustration they experience in the classroom of having students who show up one day and not another day, of feeling that lack of being able to access the student. So happy to also talk offline about some of the resources that are available online for training. And we do have, the State Department of Ed has a person who does training for school districts, and other folks who can provide training and resources on legal rights and resources.
I also wanted to add something else, because I think in my work within schools, we also found that sometimes it's also about thinking about the resources that you have differently. For instance, at some of the schools that we worked with, they were calling home to find out, why they weren't at school, or if they've been chronically absent. And there aren't really outreaches to home to find out what's going on or what the situation is, to have that information on how to help. And I think sometimes it's just about what's the issue. I think I've gone to too many schools where it's like, do you know that if you are absent one more time, you can be, face this consequence or that consequence? And it breaks my heart because we should be diving a little bit deeper to find out what the root cause is for that disconnection, that absenteeism, and maybe having some existing resources coordinated differently. Not saying that's the case in your district, but also just mentioning that as well.
Definitely punished for poverty is something we see oftentimes in the school systems. I've talked to several young people who kept their sleeping in a shelter with families and other experiences a secret so that they wouldn't be kicked out of their schools, they wouldn't get in trouble, and they would constantly you can't leave the shelter till a certain time, so getting to school late, being tardy, you get constantly penalized for being homeless.
Jackie, Angel, and Stacy, thank you again. Thank you for being with us and being for this panel, very much so.
Thank you.
And as we transition people between panels, let me just take a moment to thank the CCM staff, all the members of the CCM team who've helped to organize tonight, all the logistics, the operations, the audio, the slides, the coverage for the folks who are watching at home. Just thank you so much to the CCM team for all the work you're doing to make this commission possible. Our next panel as we transition. So our second panel tonight, too, will follow a similar format of about 20 to 25 minutes of presentation, followed by 10 to 15 minutes or so of discussion with the commission. And then by about 8 o'clock, we'll aim to open the floor for public comment for all who have attended tonight. The topic here will be the same, and we're so fortunate here again to have three fantastic people from different communities across the state of Connecticut. In no order, Lucy Freeman. Lucy is Vice President of Housing and Program Services at Insecurity, Inc., which strives to end homelessness and housing insecurity by helping individuals and families achieve stability through support services and affordable housing. Lucy has incredible experience in the field of social services, and she's a passionate advocate for young people who are growing up in poverty and experiencing homelessness or housing insecurity. Michelle is Executive Director of Open Doors. She and her organization are a great resource for the Norwalk community, for people who are dealing with poverty and homelessness in the greater Norwalk area. Michelle also plays a leading role in regional and statewide efforts to end homelessness across Connecticut. And Vanessa Lyles is Co-Project Director at PT Partners in Bridgeport, where she manages all aspects of the resident-led initiative for self-determination and empowerment for low-income housing. She's also a passionate community organizer who focuses on equity and cultivation of resident leadership in Bridgeport. Thank you all for being with us, and we turn it to you.
Thank you, Lucy. I'm Michelle Condorino. Thank you very much for having us here today, and thank you to the other panelists before who I think covered a lot of the, certainly laid a great foundation for I think the talk tonight, more on the perspective of homeless service providers, particularly those who are Lucy and myself operating shelter, as well as affordable housing opportunities and prevention services. I think that one of the things that is so incredibly important is to remember the narratives that we use when we talk about people who are experiencing homelessness. Because often that is put in a category of mental health and substance abuse. And it makes it incredibly challenging for people to feel comfortable disclosing their housing status, because there's such a stigma when they are, when people hear that they are experiencing homelessness. So I think that, you know, that's such a critical piece, that when we are talking about those that we're serving and those in that experience, that we're doing so respectfully and recognize that there are a variety of reasons, largely economic, that people are experiencing homelessness. I really appreciated the question about COVID that was asked earlier, and then I want to just take a second to give some response to that, because I think it's important to remember that there's two crises attached to COVID, right? There's the medical component, but then there's really the economic factor. And what we saw, particularly in Fairfield County, but I think was seen throughout the state, was that not only were people losing jobs during COVID, when they were getting employed again, they weren't getting employed at the same rates. They weren't getting full-time if they had had full-time before, and they may not have been making as much money. So people were really struggling. And I think sometimes we look at unemployment rate as a factor. Well, if people are employed, but they're not making a livable wage, it's really not as valuable data point, you know, that our unemployment numbers are lower because people cannot afford to live in the communities in which they work and want to live, and likely have lived, right, generationally. We're certainly experiencing that in Fairfield County in particular. But we also went through a very significant rental vacancy decrease. Fairfield County, I think in the summer of 22, was at 1.5% rental vacancy. And that didn't include affordable housing alone. That included all housing. So it's very challenging when somebody becomes homeless to get them rehoused when there is no housing stock. So I think those were some of the contributing factors. You know, when that occurred, our length of stay doubled because we couldn't exit people, which means we can't bring more people in to serve. And so more people experiencing unsheltered homelessness. A lot of shelters also had to decrease bed capacity to social distance. And so therefore we weren't as many beds to serve people as there had been. But certainly, you know, going back to my original point, narrative around homelessness, I think, is incredibly important for us to be focusing on and ensuring that we're using the right language when speaking about people and the experience and why it's happening to them. I think we also have to recognize the really important role that transportation plays, because often, again, people are really struggling with being able to afford to live where they work. I think we all experience an increase in traffic, and that's largely driven by the fact that people can't afford to live where they work. And so without public transportation options, we're really limiting people's employment opportunities. And, you know, we have staff who Uber to work. That's, even though they're going 10 miles, that's $20 each way. So they're losing hours of their pay per day just trying to get to work and back. Which is making it incredibly challenging for them to, again, meet all of these other increasing costs in their lives. So I think transportation plays a huge role. I know in Norwalk, they are doing pilot programs with almost like an Uber, but through the bus. And it's a set fee for different regions. And so, you know, or they have microbuses that go on a sub route. And I think really connecting with employers on that about when do your shifts start? You know, we are not in a 9-to-5 world anymore. Many of the people that we work with work overnight shifts, but they cannot get there because public transportation isn't running those times. And so now they're walking hours at 3 in the morning. To be able to maintain that employment position. So transportation is really huge. The other issue that I think is incredibly important is childcare. We do not talk about childcare nearly anywhere where we should. Childcare plays a really critical role when we talk about youth, because I look at it in two ways. One, many of the youth that we work with are child caring for their siblings, other family members, and so they are bound by, familial expectations that are really preventing them from attending school, attending employment, workforce development, certification programs, and it's a huge barrier. We also serve a lot of young parents, largely mothers, single mothers with multiple children in our shelter who cannot imagine being able to be financially independent because they can't afford childcare, and they can't transport to the childcare, and so they're really stuck. They're literally sitting in our shelters. They're employable. They want to work, but they cannot match up the services. Often, the access to free childcare exists when you have employment. So what are you supposed to do day one? And that's a real barrier for a lot of people to be able to attain an employment, and certainly employment in the fields that they want to be in. We talked a little bit about housing. I think, there's affordable housing, but there's also housing that's affordable. I think Connecticut had the opportunity to look at rent caps and chose not to go in that direction, but I would strongly encourage us to relook at that because we are seeing some unbelievable rent increases that, people who have been living in rental units for years, have been paying their rent, are seeing, significant increases, $200 a month. They can't make that, but then they could maybe identify another unit, but the security deposit, first month's rent, they can't get access to that. That's thousands of dollars. So they cannot afford the apartment they're in any longer, but they cannot afford to leave either. And so they're being evicted, and now they have an eviction on their record. And, that is a huge barrier. I also think when we're talking about youth, we have to talk about, depending on where you are, we have gang activity. And I always like to say, gangs don't always ask, right? Not a choice. They kind of tell you you're part of their system now. And then people get arrested, and now they have a criminal record. And it's, they were doing this and they're part of a gang, and when in reality they were caught in a situation that they couldn't get out of. So often I see young people blamed for a lot of decisions that are not actually decisions. And I think we use the word choice very often when we should not, because when you don't have a positive choice out of two choices, you're not really making a choice. I know there was a lot of conversation about people feeling safe in shelters. I could say, at least at Open Doors, we run a very low barrier shelter for that purpose. But we do see some of the shelters with higher barriers, they have higher discharges to unsheltered rates. And so I think we need to do some work to address that as well, because it makes no sense to have shelters that are just sending people back onto the streets. I think the other thing that is a little concerning, and I've been in the homeless service system for over 20 years, and I think we've developed a system in which you have to fall into absolute crisis before there is a real intervention. And I loved what one of the former panelists said about, we kind of overinvested in lightest touch. This hope that if I give you a little bit, you'll go away and I'll never see you again, and I'm going to say that's success. What I think we found is that has created a lot of people just eking over a line of falling off a cliff, and then it takes very little for them to tumble back in. And so they're perpetually stuck in this place of always living in crisis. And when you're living in crisis, you're making crisis decisions. You're not thinking about your future, you're thinking about tonight. The experience of homelessness is very much, Where am I eating? Where am I sleeping? Where am I going to the bathroom? How am I going to stay warm? How am I going to stay dry? You become very survivalist in your mentality. And that is a very challenging mentality to break, even once you return into housing. So the more we do on a prevention side, and when I say prevention, I do not mean solely eviction prevention, or I'm going to give you 3 months of a subsidy and hope you can make it from there, but really guiding people on a path of upward economic mobility. Because we have got to get people out of poverty, not trap them in poverty by giving them a complicated, highly restrictive, subsidy, but you could only do this. You can't make too much money. You can't, have all these pieces. And when people are younger, that's not as important, right? People want to make choices and have freedoms and be independent. And sometimes I think we create a system in which if you make too much money, then you're going to lose this benefit. You're going to lose this subsidy. And whether they're anywhere close to that line or not, that becomes the mentality. I can't make too much money. Or I can't show that I make too much money. And then they really trap themselves. They're not building their credit. They're drowning in debt. And we're not doing enough to do a lot of education around that. And I know that we have legislation that hopefully soon within our school systems, we will have financial literacy, but we have a lot of people who did not receive that. And we have to acknowledge that that plays a huge role in whether or not somebody can escape poverty or not. Because if you do not understand what credit is, if you are drowning in debt, employers look at that now. Landlords are looking at that now. When you've got a highly competitive housing market, landlords will look at a multitude of things they never looked at before. And so, we're finding a lot of people who either have poor credit, and I'm talking young people who have poor credit, sometimes because things were opened in their name. So utilities were put in their name when a parent could no longer get it in their own name, cell phones, and they're turning 18 already in debt, not of their making, but it doesn't matter, right? Because it's impacting their future and it's on their credit report. And so, I think we haven't always given youth, and I was so happy to hear about, the roundtables and continued discussions with young people, because I think that the story of young people is very different than what people think it is. Because I think they've had incredibly complicated lives up until this point. And they're actually incredibly creative problem solvers. And we need to honor those skills and really enrich those skills. And, sometimes too, I think employment can be heavily focused on what employer demand is in a community and not as much about what the prospective employee is looking for. And that's not just field, but that's work environment. Do you want to be autonomous? Do you like working with other people? Those are really important factors in happiness at work, and you need work to be able to have income, right? So, I think trying to instill more hope in our young people is so critical right now, because they hear so much every day about how they'll never be able to buy a house, that their Social Security won't be there for them. There's just this feeling of doom, and there is so much opportunity. And there are a lot of programs that people can take advantage of, but people have complex needs. And, we created a homeless prevention hub that focuses on access to benefits, access to workforce development and employment, and financial coaching. And we have ESL classes and we have GED classes layered in. And then we also have a community closet for clothing and a food pantry and a medical clinic, all in one building. And people can come there, and they often come in, again, in crisis and feeling hopeless, but they leave not with all the answers, but with a plan and the knowledge that somebody's going to help them, walk them through that process, and is really not, actually we kind of started talking about it as a homeless prevention, but have really started talking about it as upward economic mobility, because if the best thing I can say to you is that I prevented the worst thing from happening to you, that's not a really great, outcome. It's about you moving up in life, you generating wealth for yourself, and the ability to stay in the community that you choose, the ability to make personal choices, I think is something that, the people who are living in poverty, low income, don't feel like they can make decisions based on personal desire. And I think that's so critical. So I'm going to turn it over to Lucy to add any additional thoughts.
Good evening. Again, my name is Lucy Freeman, and I work for Insecurity, and it is really a pleasure to be here. I feel like the panel before me really spoke about so many things that were very eye-opening to the needs that we have. I also feel like Fairfield County is lacking in many areas. I'm really excited about this commission because we're going to identify what is really needed. I think that the young people has been a subset of when we talk about homelessness, they've been a subset. So we look at ways to improve things, but then it's just like they're on the side and we just give them the same things, and we can't give them the same things and expect a better result. I spent some time thinking as I was listening to the other panel, I really had to think about the people that we serve in our shelter right now. So I started thinking about the young people. I'll briefly share with you that I worked at Insecurity from 1996 to 2007. And I left there. I started as a case manager, and I left as a director of homeless programs. And then there was a 16-year gap, and I just came back. And the experience is very different, and I'm going to put Josh on Front Street since I traveled this long distance to be here. I can do this to you. But Josh was a child in that program when I was there, and things were so different. We had the resources. We were able to get people into housing without so much of an issue, and now it is such a challenge because of, when I drive around Stamford today, all I see is these big high-risers that like we're New York City, and it's sad because I know that my people are not going to be able to be in those apartments. I'm not going to be able to get them there because it's not affordable. I was just watching a YouTube informational program that was talking about the housing cartel that may be happening in various communities, and I'm hoping that Connecticut explores whether or not we have a housing cartel operating in our community. And what I'm saying is that what the channel was talking about is that there's this whole process of figuring out what the rents are supposed to be. And they put them up really high, and I didn't get all the details of it, but it makes it so people can't afford to live here. And everybody's doing the same thing, so that's the way it is. But, I come to you really to talk to you about my experiences. For me, in the family housing program, it's always been generational poverty, and now I'm actually seeing people who, I am serving their children, or sometimes even their children's children. And that's sad when someone walks through the door and says, I've been here before, my mom was here, so that it's that cycle, that we're seeing. And the young people that are in there right now, when I think about my teenagers, those teenagers are really not, they have little hope. Their hope is to get a minimum wage job so they can help mom when she moves out, pay a rent that she probably can't afford anyway. So you've got two people making maybe $17 an hour trying to maintain an apartment that is $2,400 a month. And what I would like to see is that we are more intentional about the population that we serve. In my program, I would love to be able to open up one of our suites for just young adults and provide the things that were talked about in the last panel, to be able to have people on board that they can communicate with and talk about. And I have to say that in Spirica, if you've never been, please come visit. I'm very proud of the place that I work. It's a place where, it's very important for all of us and my team that we have an environment that people can feel good about. We're fortunate enough to we've had it for years, but it was a YWCA, so there's units. So people could actually walk in and close a door behind them. And that makes all the difference in the world. When even our families that come to us now, when you give them the key to their unit, like we kind of walk them through it, and when they see those 2 beds there or whatever amount of beds that we have to give them, and they see that they have a door to close behind them, it makes all the difference in the world. And to be able to offer that to a young person is just so necessary. Angel mentioned in the last panel, he talked a little bit about 211. I'm a believer that we have to start from the beginning, like what's wrong, and 211 is broken. And it's broken to the point, and it's broken to the point that I can't imagine a young person staying on the line for an hour to get services. It's hard enough for the adults, the older adults to do it. I know I can't stand being on a call that long, but I could see them where we're missing information because they're getting on the line and then they're waiting, and I can see people, I'm not doing this. I'm not doing this. We have to address that. It's like the emperor's new clothes. No one wants to say that. And I feel like sometimes when I'm talking, I'm the only one that wants to say 211 is not working, and let's fix it. Let's start there. And we have to start there. If we don't, I don't think a lot of things are going to change. I was devastated to find out that Domus Foundation no longer has housing for their, I'm not sure what happened. It happened while I was on my, hiatus. But we need to have more programs that are directed at young people and a place for them to rest their heads. We talk about people sleeping in parks and sleeping doubled up, and that's no way to, that is just hopelessness, and we've got to start giving our young people some hope. I'll give it over to Vanessa.
Thank you. So as a preface, my comments are not answers. They are the starting points to true transformation. So good evening, commissioners. Thank you for inviting me to speak to you about these important issues. I am Vanessa Lyles, a community organizer and educator in Bridgeport, Connecticut. I work mainly alongside women residents of public housing. Our work specifically uses the principles of Black feminist organizing, which centers relationships and care for community in order to develop the capacity for creating necessary changes that benefit everyone. Paid public housing resident leaders directly engage well over 700 Bridgeport low-income public housing residents per year in mutual aid, education, power building, environmental justice, and housing advocacy, and impact about 3,000 indirectly. I'm also a member of the Community Advisory Group for the Community Science and Connecticut Opportunity Project. In the 1930s, public housing was created to house people and relieve cities of the burdens of slum areas and blight. Affordable housing development was understood to be a solution to our need for increased health and economic outcomes. Decades later, we have somehow gotten away from this understanding that housing is a solution. Providing and keeping people housed is what makes for healthier and stronger communities and citizens. Black feminist organizing also teaches that there's an inextricable nature to systems. One impacts the others in ways we cannot separate. For example, we know that in Connecticut, the wealthier neighborhoods have created more well-resourced schools. This disallows housing and education to be addressed as separate issues. So I begin from this point of view. We should address when we consider the needs of youth 14 to 26 not in school or working, their interconnected structural and systemic needs. I believe we need clarity on what we are asking. Are we asking young people who are not connected to these typical structures to get to a place where they can mimic typical behavior? Is the hope that they simply start connecting? I propose that we instead expand our ability to create a structured field that encompasses all young people and their needs. In expanding our imagination, we are looking at if we believe America is a place that allows for us all to have success, designing systems that truly allow for this success for all. It also starts a process where we look to this minority group of young people as the models for system development. Instead of designing for those at the top, we need to design for those most in need. This notion upends the way we currently plan for social support. Consider the nearly 34-year-old Americans with Disabilities Act. While addressing the needs of our neighbors with special needs, we created a system that supports everyone: women with strollers, travelers with wheeled luggage, warning sounds that alerts everyone to be cautious when crossing roads, and greater number of elevators and accessibility options for everyone. My proposal is that as we understand the specific population more, we design systems that address their specific needs. And in doing this, we will increase support and open access for greater outcomes for all Connecticut residents. But before I go further with design, I have to say that Connecticut must decide what it wants. Is housing a human right? Or are we making it a binary topic where you do everything right to have a safe, affordable place to live, or do bad decisions and behavior means you do not? If we make the right decision, as I and many of my colleagues in Bridgeport believe it to be, and decide that safe and affordable housing is a human right, then we must look at what this means for our actions around policies and practices regarding housing and its connected systems. From my professional experience, the needs of people at risk of disconnecting from school or not working are varied. Healthy relationships with adults who are placed in their lives when young, within schools, healthcare settings, social service offices, and their homes is crucial. For communities of color, trust is a necessary component of connectivity. And connectivity is what ensures greater outcomes. Again, PT Partners is a resident-owned organization where I work in Bridgeport, and it's had tremendous success engaging residents in leadership, and many have the same characteristics as this population we talk about tonight. Many are not working or find it challenging to have jobs, steady jobs. Many did not complete school within a traditional time frame. Many have been on their own since their early to late teens, and many have negative experiences with bureaucracy and administrative staff because of limiting rules that do not allow for their specific needs. But because PT Partners resident leaders invest in people and relationships with the most vulnerable members of our community, we have found a way to create powerful people who have greater positive outcomes. And we're basing this on a village model and really actualizing, not just saying it takes a village, but actually forming a village. So here are actions we can take. 1, we trust communities. We must, as a necessary step, ask 14 to 26-year-old young people and the people who care for them about their needs. Participatory action research is a strong method that allows communities to be co-researchers on matters that directly affect their lives. Again, this is a strong method we have employed that has allowed for better community decision-making. 2, we must fund grassroots efforts directly. There are hidden organizations in your community who are doing the work of connecting and building relationships with the populations we are discussing tonight, but they cannot build capacity because we do not provide funding and technical assistance to these groups. Funding traditionally goes to larger corporate nonprofits, and the hope is that it trickles down to the grassroots workers who have the relationships with the community. I know this to be the case because it is the model PT Partners has long been subject to. This model also limits our ability to scale effective work. 3, funders become true partners to grassroots. This opens relationships directly between the funders and the people who are most impacted. Funders and philanthropists have a direct relationships with with the challenges and needs of the work as a result. 4, we meet people where they are. Essential to service delivery, design, and practice are methods to understand the person to whom you are helping with services. Seek first to understand and then be understood. We did not coordinate Covey tonight. We partner, not help. The difference between help and partnership is empathy that allows for the stakeholder to recognize that we all benefit from understanding we are working with disconnected and at-risk communities and not providing charity. 6, we do mutual aid, not charity. Charity means we are providing temporary resources and therefore do not fully invest in embedded structures that perpetuate success. We seek creations that build models of mutual support. 7, we build empathy and compassion in the social services processes, practices, and policies. The very design of our systems must respond to essential questions of kindness, gentleness, and responsiveness to the person before us. Have we built a system limber enough to withstand varied needs? Young people in this study did not feel heard, validated, nor seen by not only the people working at the agencies, but the agency's policies also did not allow for a responsive approach. They are too linear and inflexible. 8, and last, we hold adults accountable to young people. We have practices funded for restorative justice, and as a volunteer for what we call juvenile review boards, I only see the student and their parent or guardian in the room. There are no other adults accountable. Often the security guard, the teacher, or the other staff who were a part of the scenario and are not in the room. When a student has asked for relief from the abuse of another student, for example, but it's not addressed either because of an untrained teacher or lack of resources, they are then punished when they take matters into their own hands. Let's truly understand the roadmap that led to the lack of resources and the hiring of inadequately trained staff. So thank you for inviting me to share my expertise. And please remember, I have offered places to start, not answers. These answers are within the communities in partnership. I invite questions and extend to you an invitation for you to come or go to grassroots organizations, including PT Partners in Bridgeport, as a part of your next steps. Thank you very much.
Thank you. Is there any chance you can leave that with us? Yeah. I know we're recording, but I kind of feel like it's a transcript we need to receive. So I'm grateful for your candor, insight. So I want to open it up a little bit to the commission for a little Q&A. And before I do that, I also just want to do a quick run around the table so you know who the commissioners are and what communities they're coming from. So starting from the left, please.
Thank you all so much. That was really enlightening. So I'm Danielle Cheesebrough, and I'm the first selectman in Stonington.
Good evening, Danielle Wong, Bloomfield, Connecticut.
Hi, Joe DeLong, Executive Director and CEO of the Connecticut Conference of Municipalities.
Mike Frieda, North Haven's first selectman.
Josh has asked me to skip over him because he's going to jump right into questions. I'm Eleanor Carbone. I'm mayor of the city of Torrington.
Andrew Ferguson with Dalio Education.
Chris Lipke, first selectman in the town of Canterbury, and just to let you guys know, probably the smallest town represented here with 5,000 residents up in the northeast section of Windham County.
Michael Pastor, I'm the mayor of the city of New London. It's in southeastern Connecticut.
And I'm Josh Brown. I work for Domus Kids. And I am, besides me working at Domus Kids, this is a very important issue that we're addressing today. And as Lucy stated, I was one of those young people that was in the shelter. I lived in cars. I lived in laundromats, abandoned apartments, everything that you hear from tonight. 14 years of that. And I want to be kind of brief. From those 14 years of homelessness, getting kicked out of every public school in Stamford, basically at one time, ending up in juvenile detention. This is a very, very important topic because I was one of those kids that fell through the cracks. And without the resources and without help, and some grit and some ambition, I can tell you that I'm sitting here today. I own homes. I paid them off already. I got a good trucking business that's going well for me right now. I worked 10 years in retail banking, but a lot of people don't make it like me. I had a single mother, 3 kids. My father was 30 years older than my mother. He couldn't really help her out because he was a drug dealer at the time. And the reason why I'm mentioning this is because I'm going to jump into the questions that I had. Excuse me, it went away. I had it here in my laptop, just so I can. So right now, it's my observation. I just told you about my lived experience with young people who experience homelessness and have a very off and on journey into finally, hopefully, making it to find stable housing. What do you think are the root causes of this off and on journey and those beginning right in homelessness? I heard about mental health and things like that, but what is the root causes you feel is putting people in homelessness?
I think, as I mentioned before, that I'm starting to see people, the second generation, third generation coming in. When I say generational poverty, there's no education, as Michelle mentioned earlier, not understanding what it is to live on your own. No one, just people assume. Typical example: even if a kid goes to college, what's the first thing that happens when you go to college? You get all of these credit cards requesting. No one ever told them, don't do it. So those are just sort of the things that end up happening. They have to fend for themselves because their parents haven't, they're not at that place where they can become. The parents can't help them. That's for sure. That's one of the reasons that tends to happen. But it goes back to the hopelessness. There's no ambition to be more than working at a like I don't want to say low level job, but just a basic job that's not paying you wages that you can become self-sufficient. And there's no expectation because who do they have to look to see that was successful in the neighborhoods that they are living in? So that's just my view of it. I can't necessarily say that's the main reason, but that's some of the things that I see.
Thank you.
I'm a very literal thinker, so when you ask that question, what I think is quite literally what causes the people to be homeless, and you can answer this better probably than I can, is there's nowhere for them to land. So if all the circumstances that may lead to them becoming homeless can be addressed, but if they have nowhere to go, then it is because we haven't provided a place for these people. We can predict that these problems will happen. Then why can't we have a space for them to go so they do not become homeless? So I think very practically, we don't have a place for them.
And that actually leads me into my second question, and I'm going to let some from the commission ask. Now, Michelle, I know in Norwalk, there's a model for those that are that have Section 8, where you can become a homeowner and where they'll basically pay your mortgage for 20 years with you being in the Section 8 program. Do you see, like, should this be modeled statewide? Why is this only in just one city, in our state? And I'm just saying that I know about, Norwalk particularly, because I was even listening to Mrs. Freeman when she was saying, like, all these big buildings are being built up, but can't nobody move it. Forget even renting them. If they can't rent them, they ain't gonna be able to buy them.
So, so that is a housing authority program. I don't know if that's because they have that elevated status, I'm going to say it wrong, move to work, or I think that's what it's called. But they've had that program. I think that program essentially what it is you, like, as if it's a subsidy, you still pay your 30%, but the actual payment goes to a mortgage, and they pay that for the first 20 years. You're right, and then the household is responsible for it. You know, I think it's a great model. You know, there's some other affordable housing, home ownership models, land trusts. One of the challenges with those programs, though, is that you have to sell at an affordable rate. So a person's ability to make money, like equity, you know, gain equity in the unit and be able to transfer that to another home is a little limited because they have to sell at a more affordable rate. I think it is a great program because it allows people the opportunity to become a homeowner, but also to think being a homeowner is possible. And I think that, you know, when I talk about like hopelessness, that's what I'm talking about. It's not like, you know, people are standing around, woe is me. It's that when they talk about employment, they're talking about, okay, so I can go work at Walmart. Like, that's the first idea. And so, you know, really getting people engaged in a future for themselves, in a vision of what their future could look like, that means that you can have things that, you know, that other people in your community have just as a right, you know, and that not somebody's going to give it to you, right? Meaning, like, you know, that you're out here looking for a handout, that you can gain those things for yourself. You know, I think we operate with this mentality, not that people are broken, that we need to fix them, but that they've had a tremendous amount of barriers placed in their way. And part of our job is to knock those barriers, you know, out of the way so that they can walk the path that they choose to walk. And, you know, I think that so many of our services are not aligned with each other. The qualifications don't align with each other. So you've got 8 of the 10 things you need to be successful, but you can't do it without those last 2. And so, you know, people are always trying to patch together resources, and that's time. And, you know, one of the biggest barriers is that, I would say, like a printer, right? If you go to an appointment, like a first intake, workforce development, you need energy assistance, they expect pieces of paper. You know, they want W-2s, they want your pay stubs, they want copies of your lease, they want all these things, and people just cannot gather all of those documents, right? That's a very labor-intensive process, and then go to the appointment, and that's one thing that you need, right? So, you know, I think we saw that with the rent relief program. That was a very labor-intensive application to be able to attain that rent relief. And so a lot of people didn't complete their applications and lost their housing because of it. I also want to say that I don't think we do a good job of ensuring that, you know, when a unit gives 10%, right, to affordable housing, you know, they're building a new development, ensuring that actually those 10% go to people who are lower income. Are they doing income tests? I think we've done studies to find that actually majoritively people living in affordable units don't meet criteria. But who's checking to make sure they're getting these, you know, tax breaks and credits, but are they actually doing the things that they say they're supposed to be doing? Are they charging the rent at the right rate? I think we need to just hold people more accountable. The amount of times that we call a landlord and they say, I don't take Section 8. You can't say that. But how many people call fair housing commissions and pursue that? And even so, what's the outcome? So, you know, we've got to start, I think, really just holding people accountable, you know, to the policies, laws that we have on the books. And then assess what else we need. But I think, you know, we've allowed to default into a defeated mindset from the onset. And I think that's causing a lot of challenges in ensuring that anybody complies, because people know, well, I evicted that person and they didn't do anything, so I'm going to evict this person too. And I bet they're not going to say anything. I mean, the amount of people that we have taken into shelter who should have never made it through an eviction, but they didn't stand up for themselves and they had no legal supports to say he can't do that or she can't do that. You know, it's just, I think people just become overwhelmed. And then again, I think then the narrative becomes they're lazy, they don't follow through. If they really cared, they would have done something. But it's, time is probably one of the things that we don't talk about as a currency. Right. But when you are experiencing poverty or just lower income and you don't have your own vehicle, you're using public transportation, everything is so much more time. And it has an impact.
Thank you. No, I appreciate that. So I'm looking at the clock and want to be respectful of the time that you've offered to us as well. And at this point, unless any of the commissioners has any other question, I think we'd like to open the floor for public comment. So your opportunity to grab a cup of coffee and some refreshments.
I also put Lucy on the spot. I don't know if you remember 20 years ago, the same thing that you said. You don't want to see me coming back in that door and it being me. So I'll put you on the spot. Thank you.
All right. So now we did have a number of individuals sign up in advance of this evening online. So I'm going to go through that list quickly. We didn't get a chance to check to see if they've actually shown up. And I will remind everyone to kindly limit your comments to 3 minutes. We're closing in on our 8:30 timeline, but we will stay to listen to anyone who has comment. So first on my list, I have Erica Bromley from Connecticut Youth Service Association. Is Erica here? Okay, I'm going to move on. John Lawler from The Connection. Is John Lawler in the room? Okay. Rich Portalance from the Portalance Strategy Group. Is Rich here? James Crocker from Letters for Our Elders, Inc. Alyssa Gendro from EastCon Early Head Start Policy Council. I'm only hoping that they all make comments online since they couldn't be here.
QR code works.
Yeah, exactly. Yeah. Gaylord Salters, Go Get It Publishing. Eliza McNamara from the Housing Collective. Is Eliza here? Sean Reeves, Motivate Kids, Inc. Shayla, I'm going to mispronounce this and I apologize in advance. Arehu, Our Loving Home, Inc. Is Shayla here? I must think she came to the New Haven. That is, yeah. All right, so now we're on to the list of people who are here and signed up as they entered. So first on our list, I have Judy Kobalars from the Be Ready Project. And the microphone is here. And from what I understand, you have to speak right into it so the viewers can see. Here.
Normally I can project the room. Okay.
Probably want to press your mic
Is
on.
the microphone on? Yeah.
There we go. Thank you. Hello, good evening. Thank you. Like Mayor Carbone said, I am Judy Kobalars Dillard. I am as founder and executive director of a grassroots nonprofit called the Be Ready Project. It's a big old acronym that stands for Behavioral Education and Responsive Emotional Awareness for Developing Youth. This nonprofit came out of the gaps in service crisis. I am a mother of 5 children. I live up in Torrington, but we are a blended family of multi-races, multi-socioeconomic backgrounds. Some of our children are adopted. Some are my stepchildren. My husband is a Black man from Hartford. So when we had to deal with mental health and behavioral issues with children, mind you, my background is in mental and behavioral health. I have 22 years in working first in juvenile facilities and moving forward, we still fell in the gaps of service. Now we have, our oldest is 18 and he is one of the 119K. He graduated from a state school and is not meaningfully engaged in anything. He cannot get himself to a job. He cannot get himself into education. And if it wasn't for the modality that we practice with the grassroots of there is no wrong door, we believe in Maslow. If you don't address the basic of human needs, hungry, angry, lonely, tired, food, clothing, shelter, you can't expect people to make higher functioning decisions successfully. So at 18, we had him, say, well, you're 18, where are you gonna live? How are you gonna do this? You're either working or going to school, and we will keep you on the cell phone plan and our car insurance. He cannot do either. He cannot engage. I've taken him to CT Job Center. I've offered him mental health counseling. Mind you, I'm his third mother. I've worked for DCF, DDS, DMIS. One of the biggest issues we have with engagement is the state of Connecticut does not have one mapping system for services. I worked as a case manager and referring people into services. So we're Region 5 for DCF, right? That's Torrington, Waterbury, and Danbury. What do we have in common in Torrington with the services in Danbury? How do we get people there? And then the demographics. So when we do have things like crisis and we talk about 211 in our services, it's a broken system. Now, mind you, I am professionally and personally, I have a plethora of coping skills and engagement capabilities, and I cannot find a place for this young man to fit into society successfully with autonomy of himself. We've tried to set up workplace plans, living plans, education plans. I'm gonna go to UHART, he says. Okay, you graduated 6 months ago. We should have applied your junior year, but he got suspended from the school his junior year for smoking marijuana. Right? We are self-medicating because we had mental health issues. He was a product of the DCF system, bounced around. So we have relational attachment stuff going on. And if you don't have the capability to connect with somebody, how are you going to engage them into doing something beneficial for themselves if they don't trust you? So I had to build an intense trust factor, a safe and brave space. He AWOL'd, he was aggressive, and during his suspension, what the school does is if you don't function in the qualifying factors to remain in the educational system, you are displaced. The No Child Left Behind Act said that everybody is supposed to be engaged at a certain level. He still missed the levels. But no child, so he was suspended to do what? If I didn't run individual life plans for everybody in my life, in my house, in my home, he would have fallen even further through because being disconnected from education, his social network, his scheduling, he was going to go downhill. What would he do if people weren't working in the home? I was working from the home, starting this nonprofit. We are completely unfunded. Yes, grassroots funding, please. And I was able to stay in the home and help him create this plan. He volunteered at the food pantries. He went to other houses and helped with yard work because keeping him out of school, he was suspended for 10 days before a season break, before April vacation. So he effectively had 25 days out of school. Try to get him to go back to school in a state-funded program. So I convinced him to go back because, well, I missed too much. I'm too far behind, the anxiety. A lot of these kids, the co-occurring, we are fitting them into labels. We are putting people into programs, not programs around people. And the amount of programs that he did not qualify for was the deficit that we sat in. So I created the programs at home. He has an LIP. So 18, your rent is $25 a week, buddy. You have a phone, you want to get a car, you're trying to get to work, where are we going to live? Half of his friends are either completely engaged or not engaged. There is no medium. They are one extent to the other, and they all graduated from the same school because we didn't individualize. And so one of the things, we talk about data collection. I have a very strong, with the Be Ready project, the responsive technique, because the system is reactive. We don't apply things until they've failed. So we put all of our eggs into prevention. Prevention, early intervention, family support, awareness to, not an attack of. If people feel that they belong, that they are supported, loved, and heard, not necessarily that they're 100% correct, but that their feelings are valid. Then you can start giving them the tools to use. But if they don't feel that it's going to be valuable, why would they take the tools and then apply them? A lot of the programs we have, a lot of the bigger entities all run on theory practice. And in order to apply it, you have to be in the community that you're serving.
I'm sorry. I do have to apologize because we do have a 3-minute limit, and I did let you go a little long. But thank you. Especially because this is a personal story for you. And what motivates so many of us in this room are those personal stories. So I do apologize, but I promise I will carpool you to the next so you can finish your story.
Absolutely. Collaboration is the key.
Collaboration.
Community health workers. Fund them. They live in the communities they serve, and they can get you access to people who are disconnected.
Thank you.
Thank you.
All right. I actually have one organization and a couple of people from the organization United Services, Inc. I have Diane Manning and Emily Morrison. Are they still in the room? Oh, good. Come on up.
Good evening. I am Diane Manning. I'm President and CEO of United Services. We are a local provider. You are sitting in the western area of our catchment area. We go to the Rhode Island border to the east and north to the Massachusetts border. If you look at your maps, where that darkest color you see, the farthest away from the cities, and the darkest color you see en masse. So we are the local community behavioral health center, federally designated. That means we provide a myriad of services for individuals for all ages. What we ask when people walk in the door is, what do you need? And it's not just about behavioral health, although that's a piece of what we do, but it's the social determinants of health. We run 2 domestic violence shelters here in the Northeast and supportive housing for individuals with all kinds of disabilities. We run the young adult services for the Department of Children and Families and DEMAS in this area, and parenting services. And we also work, I'm the co-chair of the Eastern Connecticut Healthcare Partnership, and that's an innovative program that I'd like to talk about a little bit more. But first I want Emily to talk a little bit about the services that we do with young people today here in the Northeast.
Hello, I'm Emily Morrison. I'm the Director of Development and the Prevention Services Division Director at United Services. So we made a little handout for you. So though we can talk about a lot of services, because United Services provides more than 30 programs under one administration, including homelessness and housing for individuals with serious mental illness. What we wanted to talk about tonight was our youth-facing programs, which is our youth service bureaus and our juvenile review board. So, Connecticut really does have a system that's designed to catch children before they're in crisis, and it's the Youth Service Bureau. It's drastically underfunded. Not every municipality has a Youth Service Bureau. United Services serves 6, technically, with our YSB, but there are 3 towns within our coverage area that do not have a YSB, so we serve them without funding. I really describe our YSB as the front lines of the children's mental health crisis. We have seen a 155% increase in services delivered and youth served in that program in the last 3 years. The acuity of the kids that we are seeing is off the charts. Suicidality, a tremendous amount of anxiety, fighting, using substances in school. And we work so hard to address all the needs that we have in our communities, and we have to supplement it with fundraising and private grant dollars to be able to meet the needs of our communities. So we really wanted to come tonight, and we were so excited when this got moved to Mansfield. A lot of times when issues are looked at in the state of Connecticut, they are not looked at up here in our coverage area. So we were thrilled that Chris Lipke was appointed to be part of this commission, and thrilled to have you here in Mansfield. And we would have loved to have more time for you to hear from the people who came tonight and people who serve in this community we'd love to talk with you more. We'd love for you to come out and visit our youth, because youth in Killingly are drastically different than youth in Waterbury or Hartford or any of the major
Torrington.
cities. So that is my short speech. We will submit testimony. We give you this handout here. I can't overstate how important these programs are and how minimally they're funded and how hard we work, us and other really comprehensive on-the-ground providers work to address the needs of our communities, and we do everything we can to cobble together the little bits of funding to make that happen.
Greatly appreciated. Thank you very much. 30 seconds. Go ahead.
Shortly after the commission was announced, I got a phone call from Diane saying, I want to come to your office and talk to you. And I think she said, it's nice to have someone on there from Windham County, but why is it you? But I just want to say that in small towns like Canterbury, we rely wholly on nonprofits like United Services and the Access Agency and a whole host of other groups and organizations that fill the need for us, because we don't have internal social services. So we do rely, greatly upon you and appreciate all the work that you do for us and for your region. Thank you.
Thank you, Chris.
Very well said. Thank you. Thank you for your time. And yeah, please, on the website, submit testimony and share more. These are the things we really do need to hear. So thank you. All right. Up on our list, I have Eric Prodalis from EastCon.
All right, thank you. That's perfect. Be following the ladies from United Services. And as they highlighted, looking at the map of the report, certainly the reason I'm here to speak is the impact of Northeastern Connecticut and disconnected youth. I'm Eric Bertulis. I'm the executive director at EastCon. We are one of the 6 regional education service centers in Connecticut, and we serve 33 communities in Northeastern Connecticut. And when you look at that heat map in terms of where that impact is, this is a significant part of what we do. Our agency serves families and youth from birth to 3 right through the adult communities. And we see this impact significantly in all of the work that we do. So I do really just want to kind of talk on behalf of the rural communities of Connecticut and Northeastern Connecticut. We're often referred to as the quiet corner. We're known for our rugged terrain, independent spirit, Victorian homes, spacious farms, and beautiful country skies. However, this is increasingly for young people becoming a state of disconnection. And we are seeing a significant impact. It's seen in your data. It's seen in the day-to-day experiences of our young people. That we try to connect them with pro-social activities, and yet we have limited resources in these communities. I'll reference listening to the event you guys held at Hill House and the number of folks who came forward to speak about their organizations and their startups of nonprofits and the connections of those resources. And I worked in those communities my 3 years prior coming back to Northeastern Connecticut and worked with Waterbury, Meriden, and New Haven. And what I saw there were great partnerships between schools and community organizations. There was funding that helped support that around getting kids back to school. Coming back into Northeastern Connecticut, I'm distinctly reminded of the lack of those resources and the need to think about our ability to serve those populations in a different way. Our schools are often that center of the community. And our teachers, like every teacher in the state, is overwhelmed. They're fed a lot of they're left with a lot on their plate. And so we need to think about how we can encourage that sense of bringing to bear the interest that people have to create those opportunities, and that we can partner with the schools. I look at it from the sense of self-efficacy. And in a community where we've had generational poverty and lack of economic development, that sense of self-efficacy is often eroded. And we see that in our young people who don't have that belief that there's a better future for themselves. And we need to see more of those organizations and those partnerships with our school systems where that identification is going to happen. And then those resources and connection to those mentors who will help them really grow and develop the skills that they need to become productive members of our communities and society. So I really just want to make sure that this commission is aware of the distinctions of what Northeastern Connecticut, Northwestern Connecticut are facing when we talk about this work of disconnected youth. The crisis has only grown as a result of the pandemic. We see a lot of families who are really in that doubling up situation, although it's technically a little different than what the legal definition is, but it's kids who are not moving into their own housing. It doesn't exist, but they're living at home. They're a hidden statistic. So we're not really capturing those families who are holding on to or having their kids return back to home and living at home and not really engaging in those work or school opportunities. And we're not catching that number in our statistics right now, but it's a significant impact in our region. And I would just, again, I'll send information in terms of our organization. We are really here to help and help pull some of that information together and that data. And this is the work that the RESCs are geared to do. And I can talk a lot more about all that work, but I know a lot of people have further distances to travel. And but I just thank this commission for their work and putting this as such an important topic, bringing this forward. And just thank you for what you're bringing forward with
Thank you. Thank you very much, Mr. Bertulis. All right. I have another one organization with two speakers, Jill Borbeau and Ann Miller from TEEG. And I think there's a button. Make sure the button is pushed so
There we
the
go.
light is green.
All
Got
right.
it.
I'm Ann Miller. I'm the executive director of TEAG. TEAG stands for the Thompson Ecumenical Empowerment Group. If you look at the dark little town right in the very corner of Connecticut, that's us, and we are serving the towns of Thompson, Pomfret, Woodstock, and Putnam. We serve those for youth. This is Jill Borbeau, my youth programs manager. And I did want to remind you of the darkness of that area out in our corner of the state and the lack of services. We too are a youth service bureau, and we too serve the towns who are underserved. So I do think, and I was going to say, that the youth service bureaus really are key in some of this work. The other thing I wanted to remind you of is that youth that become disengaged with school by homeschooling, once they are homeschooling, they are not part of any district anymore. I don't know when that legislation happened in Connecticut, but they become lost to the district. And the youth that we are a grassroots, birth to death social service agency. And the youth that we see that have dropped out of school, the numbers are quite high in our corner of the state. And we ran recently into some youth that had been out of school for 4 years. And the school did not want to take them back because the older one would age out before he was a sophomore. So this is a real problem. This is something that we often see, and that I would hope the commission did not see. It's important that you know about that as well.
Thank you so much for having us. I would mirror everything that Ann had said. We work closely and are partners with United Services, so we are working together on that corner. And everything that Emily and Diane said, I would mirror the same. As we're talking a lot of times, and we're talking about Ubering or transportation or all of this, that someone had mentioned the amount of time it takes for service, engaging, getting them to trust us, and then helping them find services is taking so much longer than it did before the pandemic for whatever reason. But then you bring them up to the northeast corner where we don't even have those options. I'm glad that we're here to have this conversation with you. Thank you so much.
It's true what she said. We don't even have Uber. We don't even have Uber.
I think Torrington just got Uber recently, so thank you very much. All right, I have next on my list Manny Sandoval from Youth Advocate Program.
Hello, how you doing? Thank you for this. My name is Manny Sandoval. I'm a program director for the Youth Advocate Program, and I have more of a question, all right, than anything else. Knowing that our young people are disenfranchised, disconnected, and at risk across the state for multiple reasons, and knowing that many of our youth are unemployed and that they don't want to be in school because they either feel unsafe, uncared for, or unworthy of support. What are we planning to do to change the current school system that focuses solely on the state mandated testing instead of educating youth in all aspects of life? And by the way, I specifically work with a lot of teachers in Hartford, and all of them, pretty much all of them, hate the fact that all they do is get the students ready for testing at all times. It's like that's all they solely care about is the testing. And so you have teachers that some of them want to connect with their youth, right? But they're not really able to because they have to get them ready for this test. And so I'm wondering what are we doing? Back in I want to say a few of the guys up there, some of that. I don't think Josh would have went through this, but back in my day, we had vocationals, right? But you started in middle school. You started doing home ec, right? And you had woodworking and all that stuff. And somehow along the way, we took that away from the students, and we want them to be engaged in school. All right, what are we doing to bring that back to school, right? Because that was like the level that it made the playing field level across the board. You either did home ec, you did woodworking. Some people were good at this, bad at that, right? I mean, why can't we bring that back? Instead, we gave it to Porter and Chester and other, Lincoln Tech or something like that, right? So that they can make money instead of, educating our youth on everyday things that they need to know, right? And that's one of the things that I'm wondering, what can we do to bring back, to take away state mandated testing and make it so that it brings the youth back into the important factor there, because right now they're not the important factor. Is that the state gets to look like they're doing something good, and that's my question. What can we do? Thank you.
It's a great question. I think when I was on the Board of Education, we used to call that comprehensive education. So I hear
I
you.
had woodworking in high school, middle school, but I remember going to woodworking in high school. But I
Career
got it.
paths. All right, so I have one more on our list. Yes.
Oh.
Yeah. All right, so Pat Stolman from the Children's Community School is here with us also.
Thank you very much, and thank you for all of you on the committee. I am with Children's Community School, which is a small school in Waterbury. I just want to tell you one quick thing about that. I was reading something that was left in a file. It was a poem that a child had written about a picture that she had taken, and it was of a tree. And of this tree, she had written about, she named the poem Believe. And one of the comments that she had mentioned was about that she believed that her family loved her and other things that were, when I read it, I was so impressed with what she had written. And I went because I hadn't known this child, and she had left the school the year before, and I had asked some of our instructors about what became of her, and unfortunately we didn't really know because her mother had left her and some other harsh things had happened in her life. And when I reread that poem of hers, I read it as, she believed that others were there to help her and that others were there to do the best they could in the classrooms. And I see that in our teachers and the staff and the counselors every day. And these children that are facing such difficult challenges, and as they get older and feel, some of them unfortunately could be disconnected. But I just, one of the wrap up of her line was at the end that of this tree that she had taken a picture of, that we were all like the branches of the tree because we were all connected by love. And that's one thing that I just wanted to thank everybody for the belief that you give all of these children that are, and there are still children 14 to 18 to 26 that are having such challenges in their life, and what everybody in this room and what all of you are doing to give them the hope and the belief that they can get beyond the challenges that they're facing on a daily day, that sometimes when I hear about them, I'm just floored that they are such positive young people and are so caring to others as well. So thank everybody here for everything that you're doing for these children that are maybe not disconnected yet, and those that are disconnected, but for giving them that hope and the belief that they have a brighter future. So thank you very much.
Thank you, Mr. Stolman. Sarah Fox from Connecticut Coalition to End Homeless. There she is.
So Sarah Fox, I'm CEO of the Connecticut Coalition to End Homelessness. We lead the statewide initiative to solve homelessness, and work collaboratively with partners and advocates and people who are currently or formerly experiencing homelessness across the state. First and foremost, and what I always share, is I experienced homelessness as a youth, as a child, and then I grew up in severe poverty. And it impacted, like so many others, my ability to think I could do. And so I ended up almost not graduating, well, not really doing well in high school, but never seeing college in my future. And it was just struggling. And my big sister, she struggled as well. She dropped out of high school in 10th grade, and she experiences homelessness today. And it is something that when you experience housing insecurity, it is impossible to be grounded in education. It's impossible to think of anything else than survival. And when we are presenting this or when we're thinking about this, we have to think about capacity and also the lost capacity. Because if I did not have a professor in community college that I was really fortunate to just go to because I thought there was no other option, who believed in me and had one conversation with me, who said, you can do this, I would not be where I am today. And so fostering connectedness, building and wrapping around our youth and our children and recognizing their capacity and their inherent capacity to build and grow, and that the foundation of that is housing and it's security, and it's something that is fundamental and is a social determinant of health that we must build upon across the state. One of the things that was not mentioned that I think is just critical that you all understand, and I'm really deeply appreciative for your voices and your work here, is that we worked closely with community providers across the state to understand unsheltered individuals across the state who could not come inside to services because we did not have capacity to serve them throughout this last winter. So as of April, and almost throughout the course of winter, there were almost 1,000 people who were unable to be served by warming centers because we did not have capacity. This included, and includes, as of April 17th, 45 youth across Greater New Haven who are not able to come inside because we do not have capacity to serve them, and those are of the youth that we know, and these youth have been identified through outreach. And 22 youth from 18 to 24 across Fairfield County. Also, very disturbingly, we have seen across the winter almost 40, sometimes to 57 children up to 18 who are outside. And when I say outside, I mean living in tents, living in cars, and living in places unfit for human habitation. We have seen in Fairfield County today, there are 27 children who are outside in cars and in tents, and we have 11 in northwestern Connecticut. We are seeing more and more families falling into homelessness than ever before, and this means moms who are going to work and they're dropping their kids off at daycare, and then the whole family is returning to their car. The affordable house, and so Mr. DeLong, earlier you asked, what's the difference? Why were we doing so well before? We have a system of care in place. It has been chronically disinvested in, and we stood up our coordinated access networks, which our providers are doing great work, but we don't have the funding to really be able to do the work in the way that we need to. And so it's going to take us all working together and really providing supports, but also resourcing providers to make sure that they can adequately meet the needs locally in every community across the state. So thank you very much.
Thank you. I appreciate you. Thank you very much. All right. I don't have anybody else on our list. I could do a quick all call. Anybody else that wish to address the commission? We did pretty good. We're only 15 minutes late. So thank you all very much for coming out. I'm going to turn this over to Andrew and or Josh to close us out.
And as I started, I'll hand it to Joe DeLong.
There you go. Even better.
Got punted to again. So first off, I think by the time we're done doing this, Mayor Carbone will be qualified to go to work for The Price is Right. Come on down. You know, it's quite a bit of that. So I want to close just a couple things. Number one, just thank you. Thank you to our panelists, invited panelists tonight. Thank you to those who came up here and testified, and to those of you who submitted written testimony. And thank you to the CEOs and of course, Andrew and Josh for serving on this great effort and taking this on. Listen, I know that all of you don't recognize this. Some of you do, but I work with them. This is budget season for all of these folks locally, and their schedules are insane right now. Absolutely insane. And for them to take their time out to be here, I think shows their commitment to this issue and to these 119,000 young people. I mean, we say, one of the things that has always concerned me about the name of the commission when we came up with it is you say it enough and it almost desensitizes the 119,000. It's not a number, it's faces, it's people, it's their realities every day. And I think that Dalio has a great graphic when they talk about, and I'm sure you've probably seen it, they have this great graphic that says that if you took these kids and had them all hold hands, that would go across the entire state from corner to corner. That's remarkable. The visual of that, when you think about it, I'm old enough that I remember Hands Across America. You know, some of you probably a little younger don't remember that, same as I do, and how powerful it was. Well, those chains broke. Those hands didn't go all the way across America. These hands would cover the entire state. And I say that, I guess, before I completely close, to share a little bit about me. Not my personal life or anything like that. I know we're winding up, but I have acquired over the years experience, and in some areas, I think it's fair to say, whether it may not sound very flattering, a level of professional arrogance. There are things that I know that I'm pretty good at. I can coach football and basketball. I could take kids and say, if you listen to me, I'll turn you into a pretty good player. I know what I'm doing. In CCM and running the organization, everybody may not agree with every decision that I make, but we run a pretty robust organization. We take on a lot of issues. We handle our financials well. I'm pretty good professionally at what I do. I feel so inadequate when it comes to this conversation. I think being a parent at times, if you're a parent, you always feel a little inadequate, like you can't be enough for your kids, but you find a way. This is the most inadequate that I think that I have ever felt in terms of since I became an adult and got into the professional world, because this is so important. The stakes are so high. And I can tell you that I think there are a lot of people in this room, clearly, and people who testified today, that are far greater experts than me. I'm just one person who gets to sit up here. But I think my colleagues would agree, far greater experts than them. But my point is, through all that inadequacy, we have to find a way through, because nothing is more important than this. And the only way we do it is to do it together. I don't see success without it being done together. I think it has to be that way. And so for those that are listening at home, thank you. And for those that are here, thank you. And I ask you to continue to stay engaged with us. Follow us around, chase us down. I will tell you that there are things we're going through my mind that I want to share with the commission, but I'm going to find a way not to just share them with the commission because I sit on it. I'm going to put them in my own testimony because I want them on the record publicly, and I want other people to be able to see them and react to them, because this work is so important. So Our next meeting will be next month in Trumbull. I think we'll have some other commission meetings in between there of meeting with some disconnected young people in another part of the state. But our next regional meeting will be in Trumbull. And I apologize, Andrew, the topic, do we have that in front of us? Does anybody remember it's on the, oh, it's on here. Okay, child welfare right in front of me. So this is the other thing that comes with age, folks, you don't. So child welfare and justice system involvement, another one of the important and critical drivers. And as you can see, again, some really well-versed, had some opportunity to work with some of these folks and that are on there, and really amazing panelists. So if you can be there, I would encourage you to attend. If you can't be there, I would encourage you to tune in and listen. And even on the Facebook Live, there is comments and engagement. And believe it or not, we go back and we read all of those afterwards as well. So continue to stay engaged with us, continue to follow the schedule of these meetings, and continue to reach out, because we have to make progress. We have to be successful. We have to get to the 2 references to Stephen Covey tonight, but we have to get to that end that we have in mind. But we won't get there alone. We have to get there collectively as a state. And so drive safe. Thank you to everyone. Thank you to all of those in this room. And I look forward to seeing you all again very soon. Thank you.
Thanks, Jen.